consultations, that our deliberations today shall take place in the spirit of mutual trust, so that we as leaders shall lead our country on the path of peace and shall find solutions for issues and problems facing us. Grant us the mercy, O Lord, that we shall today also honor thy name in all we think, do, and say. Almighty God, we pray thee, bless our land and all its people. This all we pray in the name of Jesus Christ our Lord. Amen. Affirmation. I solemnly affirm that I will be faithful to the Republic of Namibia and its people, and I solemnly promise to uphold and defend the Constitution and laws of the Republic of Namibia to the best of my ability. Honorable members, are there any messages from the head of state? Any petitions? Reports of standing or select committees? Other reports and papers? Yeah, honorable members, we are advised by the team from the Hansard that in order for them to notice our presence, we need to press the button there to register, to sign in. It's called signing in. So if you come and you don't press the button there, you'll be recorded absent. Yes. Yes, it's a register. That's why you are being advised. Honorable, notices of questions. Honorable Hishono. No. Just press, you have pressed already. You are registered already.
Thank you, Honorable Speaker. Notice of questions. Am I protected?
Hishono, you may proceed. Is your mic on?
I hereby give notice that on Thursday, the 11th of June, 2026, I shall ask the Honorable Minister of Environment, Forestry, and Tourism the following questions. Honorable Speaker, on the 1st July 2022, the Minister of Environment, Forestry, and Tourism issued environmental clearance certificate to Head Spring Investment Pty Limited for uranium exploration in the Stamrit Artesian Basin, followed by a further environmental clearance license certificate on the 10th of October 2023 for a field laboratory to the same company. These clearances were granted despite the basin being protected resource under the Water Resource Management Act 11 of 2013. This has created a direct regulatory conflict as the Ministry of Agriculture, Water Land Reform subsequently rejected drilling permits, citing a certainty of pollution to an aquifer that serves 80,000 people and is shared with Botswana and South Africa. I therefore put the following questions to the Honorable Minister. I thank God we don't have time. No time allocated to me.
Honorable member, you may proceed, please.
Number one, why did the ministry issue this certificate of activities that appear to directly violate the Water Resource Management Act, which prohibits discharging pollutants into protected water resources? Why was an environmental impact assessment approved that failed to address the hydrogeological risks later cited by the Ministry of Agriculture as a ground for rejecting drilling permits? Has the ministry conducted bilateral consultations with Botswana and South Africa regarding potential contamination of this shared resource? I so submit.
Yes, please table the questions. Honorable member, table the questions. Yes, Honorable Hangula.
Thank you very much, Honorable Speaker. Good afternoon, honorable members. On the introduction of expanded policies for minor offences committed by youth, I hereby wish to state that individuals who have committed minor offences, such as petty theft and other non-violent infractions during their youth, often carry permanent criminal records into adulthood, even after demonstrating rehabilitation, acquiring education, and personal growth. The existence of criminal records for minor offences, therefore, limits access to employment and other opportunities. This prevents capable young people from fully joining society and contributing to it meaningfully. As a result, these records contribute to increased unemployment and social exclusion. On the other hand, countries such as South Africa...
Honorable member, please can you ask the question? No,
literally the last sentence before the question, Speaker.
Honorable members, I have informed the members several times, and I would like to repeat it again today. That expression is unacceptable, is outside of the rules, Honorable Member. The rules do allow the presiding officer to guide the MPs, and you can't say the presiding officer is wasting time. The Honorable Member is making a statement.
Am I protected? Like literally
No, you are protected, but I have a right as a presiding officer to guide you if you are out of the rules. You don't have to be pointing me to the clock. You should advise your member also to comply with the rules. That is unacceptable conduct that is consistent from specific MPs from certain political parties. So I just wanted to raise that point. I'm not saying the member will not be allowed, but it has become a pattern. Honorable members, can I have your attention? That you please pose your question. Yeah.
Honorable Speaker.
Yes, just proceed, Honorable Member. Just proceed. Just proceed.
To where? Because I literally
to ask a question. To ask a question.
No, but I need to give context to where the question is leading. This is like literally the last paragraph before the question comes.
So, Honorable Member, I hear you. You have a right to explain, which I had allowed you to do, but the presiding officer has the right to rule.
Honorable Speaker, I have 2 minutes, 3 minutes.
No, Honorable Member, please proceed.
How much of that time
proceed, Honorable Member, just ask your question. Just ask the question, Honorable Member. I'm not saying stop, I'm just saying get to the question.
On the other hand, countries such as South Africa have established legal frameworks that allow individuals to remove certain criminal records related to crimes committed by minors after a specified period. These measures provide a pathway for rehabilitation and integration into society. Furthermore, other African countries, including Kenya, have legal mechanisms that allow for individuals to refrain from disclosing minor offenses after the rehabilitation period. Questions? It is against this background that I hereby give notice that on Thursday, the 4th of June 2026, I shall ask the Honorable Minister of Justice the following. What legal framework currently exists in Namibia for expunging criminal records for minor offenses committed by individuals during their youth? Does the Honorable Minister not agree that the lack of accessible expungement frameworks contributes to youth unemployment and social exclusion? And last, are there plans by the Ministry to introduce legislation that allows for the expungement of minor records under specific conditions? I so submit.
In a serious note, we cannot be abused by Speaker.
No.
I have been trying to do throughout the session. You see, I have faced concerns from executive members to whom these questions are posed and they have to respond. They are also complaining that, Speaker, you allow members of Parliament to have a page just making a statement and then ask 5 questions. after making a statement. But you expect us to comply with the rule that says we must respond in 5 minutes. So I'm trying to balance, to be able to say to the minister, keep within the time with your questions, and the other members also comply with the rules in posing the questions. But there is a resistance, and there are some MPs truly that resist in a grossly disrespectful manner to the rulings of the presiding officer. I want to emphasize, honorable members, you have a right under the rules to seek for the overturning, for the ruling of the presiding officer to be changed, if you feel that it's unfair. But there is a procedure. You can't just argue with the presiding officer on the floor. Otherwise, you have no right to ask also for the presiding officer to protect you when other people interrupt you when you are speaking. Now, having said that, I will proceed to Honorable Mulunga.
Thank you very much, Honorable Speaker. I hereby give notice that on Thursday, 4th of June, 2026, I shall ask the Minister of Agriculture, Fisheries, Water and Land Reform, Honorable Inge Zamwani Kamwe, the following questions. The fishing industry is deeply alarmed by the Cabinet decision to relax the granting of exclusive access to a very small group of wet-landed horse mackerel vessels to fish as shallow as 150 meters within the restricted isobath zones, areas widely recognized as critical fishing grounds. These areas present almost 1/3 of Namibia's horse mackerel zone. For decades, it has been shared fairly by the whole industry, including 10 freezer vessels, 66 Hague vessels, and 14 Monk vessels. The Cabinet decision appears to exclude more than 90 vessels from this area, while a handful gain exclusive rights. That is an unusual system, and it goes against the principles of fair, transparent, and inclusive resource management that Namibia has built on reputation. I therefore ask the following questions. Can the Honorable Minister confirm how many vessels his decision is capable to? Can the Honorable Minister confirm precisely how far south this exclusive zone extends and where the remaining vessels that have historically operated in this area are expected to fish? Number 3, does the Minister agree that the decision, which excludes more than 90 right holders from nearly 1/3 of Namibia's horse mackerel zone, while granting preferential access to a handful of operators, constitutes an anti-competitive practice? And has the Ministry referred this matter to the Namibia Competition Commission for investigation, or does the Minister intend to do so? Fourth and finally, can the Minister explain how the Cabinet decision aligns with Namibia's long-standing principle of fair, transparent, and inclusive fisheries resource management? And will the Minister commit to suspending the implementation of this decision pending a full, inclusive, and science-based review that includes all affected right holders in the industry? I so submit.
Yes, Honorable Lucato.
Honorable Speaker, leaders of various political parties, members of Parliament, today, Wednesday, 29 April 2026, I hereby give notice that on Thursday, 4 June 2026, I shall ask the Minister of Health and Social Services, my relative sister, Honorable Dr. Luvendao, the following questions. Honorable Minister, it has been observed that the Omungulubashe Clinic, which was constructed in 1994, has never undergone any renovation since its establishment. Currently, the facility is in very poor condition, which is regardless affecting the ability of healthcare workers to deliver quality health services to the residents of Omungulumbashe. I want to ask the following two questions. Honorable Minister, when does the ministry plan to renovate the Omungulumbashe Clinic? Second one, do you intend to visit and inspect the condition of this clinic to assess whether the required renovations should be treated as a matter of an agency? I so submit, Honorable Speaker.
Yes, please table the questions, Honorable. You see, that's the challenge that I face. Some members recognize the authority of the presiding officer when they want the presiding officer to call the other members to order. But when the presiding officer wants to call them to order, it's a war. It cannot be that way. That will not be accepted. We have to be consistent. No, I want to understand. Let the honorable member proceed and say what point she's rising on.
Thank you very much. Honorable Speaker, honorable members, the Chief Whip is consulted, and based on that, I submit to the honorable members a request to consider and agree for us to meet tomorrow morning from 9 o'clock to 12:30. I so submit, Honorable Speaker.
Yes, honorable member,
The House,
we
the
are
House
now,
must agree.
honorable member, we are now dealing with questions. Yeah, so let's first, yeah. Yes, Honorable Kalola.
No, mine is an oral question.
Okay, the next one, Honorable, please just take your seat. Honorable Kambala.
Oh, am I next? Oh, mine also oral agent.
Okay. Honorable Haikola.
Thank you, Speaker. Recently, the Ministry of Urban and Rural Development had a long week meeting in Ochivarongo as part of consultations to amend the laws on traditional authorities. It is incumbent upon the responsible ministry to do wider public consultations, especially with the affected stakeholders and the communities. The provision of the Traditional Authorities Act 2000 affect almost everybody, including all traditional communities, mining companies, tourism operators, and aspiring business in communal areas. Against this background, notice is hereby given that on Thursday, April 29, 2026, I shall ask the Honorable Minister of Urban and Rural Development, James Angwasa James, the following. Honorable Minister, you are on record that you have excluded certain traditional communities from these consultations and only invited those that do not have disputes. Is this the ministerial positions that recognize traditional communities have no voice in the legislation process because they have internal disputes? 2, are you going to hold further consultations with the traditional communities that were not invited to the meeting in question? I so submit.
Yes, table the questions, Honorable Member. Honorable Venani. Okay, Honorable Shitana. Honorable Muton.
Thank you, Speaker. I hereby give notice that on Thursday, 4 June, I will ask the Minister of Justice and Labour Relations the following question. The Whistleblower Protection Act was enacted nearly 9 years ago in 2017. Despite this, the Whistleblower Protection Office is yet to be established, and the necessary regulations have not been gazetted. This administration frequently asserts that corruption is treason, and that accountability is a core pillar of our national governance framework. However, the repeated failure to implement this specific, crucial piece of legislation suggests a gap between rhetoric and action. This administration prioritizes gazetting salary increases, yet it repeatedly fails to gazette and implement legislation that can actively fight corruption. Without a safe, legal, protected environment for whistleblowers, our efforts to combat systematic corruption remains fundamentally handicapped. I therefore ask the Honourable Minister of Justice the following. Can the Minister provide a detailed breakdown of the specific administrative, financial, or legislative hurdles that prevented the implementation of this Act since 2017? When will the Whistleblower Protection Office be established, and when can we expect the appointment of the Commissioner and Deputy Commissioner as required by Part 2, Section 6 of the Act? What is the definitive gazetted timeline for the full implementation of this Act? And finally, in the absence of this office, what specific enforceable legal protections does the government provide to citizens who expose corruption in the private and public sectors today? Thank you.
Yes, thank you, Honourable Member. Thank you for the questions. Yes, I just would like to indicate that, no, please, table. Yes, I just would like to indicate that the time for questions is lapsed, but I will try to put in 2 more members. Let us try to be to the point so that we can accommodate as many people as we can. Because I allow at least 3 minutes for us to add there. The next is Honourable. Now, the Honourable members who indicated oral agent questions are supposed to switch off and press again. Because now the list is mixed. I don't know which one is, I think it's Honourable Lizazi. Can the members please, I see Honourable Venani, the Honourable, you were supposed to switch off and press again so that you,
Thank you very much, Honourable Speaker, for the floor. Honourable Speaker, Honourable members, I hereby give notice that on Thursday, 30th April 2026, I shall ask the Minister of Justice and Labour Relations the following. Her Excellence, in her SONA, challenged the nation to verify with the Social Security Commission that government created 130,000 jobs in 2025. It is misleading for the personnel in the President to advance wrong data. Many youth companies were registered last year to qualify for the National Youth Development Fund, and many of them did not get this financial support, but they have registered employees with the Social Security Commission. The Namibian Labour Force Survey is the official source of statistics on employment, unemployment, and the informal sector. It underpins national planning, NDP 6 implementation, and Namibia's reporting under ILO convention. The last one was held in 2018, was released in 2018. Since then, Namibia has faced COVID-19, drought, major shift in mining, tourism, and agriculture, yet policymaker, parliament, and the public still rely on 2018 data. Section 10, subsection 1, paragraph C of the Statistics Agents Act, I'm landing. Act number 9 of 2011 requires the Namibia Statistics Agents to produce and disseminate official statistics timelessly. The 6-year gap undermines evidence-based budgeting oversight. Against this background, I shall ask the Minister the following questions. When was the most recent labor survey conducted, and when will the next labor survey be conducted? What are the reasons for the delay in publishing labor market data since 2018? What interim data or survey is the ministry using to monitor unemployment, especially youth unemployment, in the absence of the labor force survey? How much was budgeted for the labor survey in the current budget? Will the minister undertake to table the full labor survey report and methodology in Parliament within 30 days of release. I so submit, Honorable Speaker.
In your questions. And maybe some of you, when you are asked to summarize, it becomes a problem. Yeah, and that is the only reason why I allow you to try and summarize. But from tomorrow, honorable members, you go to the provision that deal with the questions. And if you do not comply with that provision, and you are asked by the presiding officer to comply and you refuse, the presiding officer will rule that the question will not be accepted. That is just an announcement that I have to make, because that is point number one. Point number two, the honorable members are to take note of the rule that says when the presiding officer rises, the members would be silent. There can be no argument with the presiding officer. Yeah, so that's really the only, I want to give that flexibility for today, but now we are left, I think we want only one person to ask a question, Honorable Mongo, and then we go to agent oral question if, what is it?
I hereby give notice that on Thursday, 4th June 2026, I shall ask the Minister of Justice and Labour Relations.
Yeah, model MP in terms of asking questions. Sorry to interrupt you. She just gets up, she gets to the point, and she asks her questions. Yeah.
I hereby give notice that on Thursday, the 4th June 2026, I shall ask the Minister of Justice and Labour Relations, the Honourable Philemon Wise Emmanuel, the following. Despite Namibia's Labour Act 2007 and the National Minimum Wage Order of 2024, many domestic workers, farm workers and security guards are still being underpaid and exploited. Yes. The law guarantees every worker at least the minimum wage, which in 2026 is 15 hours for domestic workers, 14 hours for farm workers, and 16 hours for security guards, rising to 18 hours in 2027. However, reports of low pay, no contracts, unlawful deductions, and underpaid overtime continues, raising serious concern about weak enforcement, workers' dignity, and Namibia's constitutional commitment to fair wage under Article 95. I therefore proceed to ask the following questions. Since the commencement of government notice of 2024, how many inspections has the ministry conducted to verify compliance with minimum wage laws for domestic workers, farm workers, and security guards? Given that domestic workers and farm workers are employed in private farms and households, where abuse is often hidden, what practical enforcement measures has the ministry introduced to protect them? How many labor inspectors does Namibia currently have, and is that number sufficient for national enforcement? Does the minister believe a worker earning these minimum rates can realistically afford rent, transport, food, and school costs in Namibia today? Lastly, when will government move from a minimum wage model toward the constitutional goal of a living wage as stipulated in Article 95? I so submit.
Table the questions. That exhausts the time for questions. Now I will give not more than 20 minutes for agent oral questions, starting with the Honorable Venani. Yes, honorable members, the time is up, unfortunately. We have 20 minutes. Yeah, Honorable Venani has the floor, please.
Honorable Speaker, today you are my target also.
No, you don't have the floor. You don't have the floor. No. No, I called now Honorable Venani. I note that one. Okay, I had now already given the floor. I note that one. I ask honorable members that you switch off the mic. Honorable member, can you now take your seat? You have made your point. I'm trying to answer you. Yeah, I have a problem that there are some MPs who want to be heard. Whatever they say must be complied with, but they are not willing, not want to comply with the ruling of the presiding officer. I cannot agree with that one. The point I'm trying to make is, honorable members, assist me. When you put on your light under questions, and I call upon you to take the floor, but your question is oral, and you say it's oral, you switch off and then you press again, so that you can be at the bottom. And then you'll be the first one to be called upon when it's urgent oral questions. But now you have some members, even if they switch off, they don't want to switch off. Now you have one person is oral, the other one is notified questions. That's why we have some people who still have question papers. That's a problem. So please, let us try. I ask Honorable Karola to switch off, and I can see the name is somewhere at the bottom. Yeah, so Honorable Venani can now continue. Please, we cannot continue to have interruptions.
Honorable Speaker,
Mike is not on. Honorable Speaker, on a point of privilege and in memory of our founding speaker, this house is the house of the people, representative of the people of Namibia.
Okay, what point are you raising on Honorable Minister?
No, I'm raising an objection on a matter.
I thought you said the agent oral.
It is an agent oral question, but before that I have a point of privilege.
No, Honorable Member.
Speaker, you have a right to hear me.
No, Honorable
Speaker, you have a right to hear me.
No.
Hear me out.
No. You
Maybe
rose on an agent oral question.
Yes, I will.
No,
but I raise a matter of procedure.
You can't package things, Honorable Members. No,
privilege.
No.
How is Honorable Kalola allowed to
come
like that to Parliament?
What?
In the People's Representative House, and you allow it to happen.
To do what?
How is he dressed like that?
No, it's rowdiness. That's why I'm saying there are some members who
consistently... I was fired here by Chitendero. No.
Yeah.
We can't do that.
No.
This house represents the people of Namibia. And we must give respect to those people.
Yes.
If he is allowed to come like that, tomorrow morning I'll come with my jean and take it and you will do nothing about it.
Honorable Member, now on what point are you? Is it still urgent oral question? So, Honorable Member, you made a valid point, but you did it in a way that is out of order.
Okay, I'm out of order.
Yeah, because every violation of the rule is the same. I have told the Honorable Members that one day I am going to...
You can't do two wrongs now.
Yeah,
you said I'm out of order, so leave Kalola alone.
No.
Yes, leave him.
You are not the presiding officer, Honorable
But you said you ruled me out of order. Now you are ruling on a point of out of order now. Why are you correcting a point that is out of order?
No. Now you are arguing with the presiding officer.
I caught you.
I thought you are one of the most orderly MPs, but you are getting out of order now.
Honorable Speaker, I want to ask an urgent oral question to the Minister of Environment and Tourism. I believe all the ministers now have spent a number of days in their ministries, and they should know the issues that are affecting the people of this country by their fingertips. Honorable Minister of Environment and Tourism, there has been environmental impact assessments done in your ministries on marine phosphate mining in this country by independent companies. Why haven't you revealed these findings of this phosphate mining? Is phosphate mining a viable option in the country, as the reports are allegedly suggesting? Or what is the campaign behind smothering some of these scientific reports that are out there to become public documents, so that we know whether Namibia should take the route of open phosphate mining, as the reports allegedly suggest that they have cleared them? Why are we having a ministry having reports that are being done in national interest and keeping these documents only in the ministries, and the country is not told on what is this impact assessments reports are saying? Thank you very much.
Honorable Member, for the question. Yes, the question is a pertinent question. I know that there was an environmental impact assessment done, but as of now, I have not received the report myself, so I cannot comment on something that I have not seen or report has not presented to me as yet. But it's a valid question that you are asking. Maybe it's just also maybe a reminder for me just to follow up on it. I shall submit your honorable member.
Honorable Hengari.
Speaker, thank you very much. I want to seek your indulgence that once we've exhausted all the oral questions, that please consider those of us who are still left with written questions. Thank you.
Yes, Honorable Thomas. Oh, he left. Okay, Honorable Kandorodu.
Yeah, thank you, Speaker. My agent goes to the Minister of Health. Honorable Vidal, your ministry is planning to set up biometric system at Central and Cathedral Hospital, State Hospital, while there is a limited stock of some medications such as lignocaine, vitamin K, bromectin, and as well some of the hypertension patients have been referred to private pharmacy to go and buy their medication because the state hospital cannot supply it. So now we want to know the agency of having biometric system to control staff members while your pharmaceutical system lacks stock. Why should you not environment that money and fill up your
yes, Honorable.
Your medical
Point of order, Honorable Member.
Honorable Speaker, as a Deputy Chairperson of Gender and Health, and the question being asked have emanated from the meeting where we have planned to invite the Minister to clarify those things. Can this question really be allowed when we discuss things at the committee and then they are brought here in the form of questions? I just felt that the questions, we are already dealing with it at the perspective of the committee.
Yeah. No, in terms of the rules, a matter that is before a committee may not be raised in the House. I would like that to put it to Honorable Kandorodo. Is that so, that the matter you are raising was indeed is being considered at the committee?
In our committee, we never discuss about biometric system to be set at the hospital. It's a general discussion of lack of medicine and that general discussion. This one is specific. And then we have patients that have been referred to private pharmacy to go and buy. People that don't have medical aid, ELTAs. So that's what they want to hear from the minister, their minister, not their backbencher.
Yes. Yes, unfortunately, because this is not a written question. You know, if it was a notified question, I was going to receive the notified question and I will check the facts. But now I'm unable to make a determination. So I have no choice than to allow the minister to answer the question.
Thank you.
Member for the question.
So on the get-go, allow me to just clarify that what we're dealing with are two separate things. So that's why when we talk about the budget, we talk about various votes and various line items. We are the same people that complain that you've made the facilities, the healthcare centers, 24/7, but you have no method of checking to guarantee that your doctors are arriving on time, because patients are still waiting for hours on time. And so when the ministry now tries to transform that system so that we are providing that strategic reform, then it becomes a problem. So let's clarify things. There's the issue of medication, and I must clarify, the issue of medication, the ones you've particularly mentioned, is not an issue of funding. Because your argument, reasonably so, is to say, why are we diverting funds when we don't have medication? But inherently, that argument is then flawed, because that presumes that the issue with medication is a financial issue, and it's not. The issue with the delivery of medication is with lead times, with suppliers as well as manufacturers, not a funding issue inherently. And so those are two different issues we're dealing with. With regards to the biometric system, once again, it emanated from complaints in the communities where people were saying, Lubindao, your doctors are not arriving on time. They leave when they want to. We come, we sit for hours, we wait, we are at the state facilities while specialists have been given limited private practice. They leave state facilities, they go to their private facilities while patients are waiting in line. Those are the concerns that we've received, and because we do not want to be reactive, but we want to respond according to the complaints and the needs of community members, we then sought it right to say, let's pilot a biometric system, which then means, and this is nothing new, it is happening all across, where you clock in when you come into work, you clock out when you are leaving work, so that we as a ministry can better track and be better accountable to the community and say the doctor was supposed to be there at 8, they arrived at 9 o'clock, and therefore they owe the government 1 hour, which will be set off in one way or another. So we back it. However, if the honourable member still thinks that there is merit to question it, feel free to bring it forward. Thank you.
Yes, Honourable Kambala.
Yes, thank you, Honourable Speaker. Mine is on hopefully the Deputy Minister is able to answer. Is it okay if I ask the Deputy Minister?
No. Let me get the gist of the question. Let me get the gist of the question.
So mine is just on the subsidy. The subsidy on education. Or you can't answer. Okay.
Yeah, that's why I'm saying let me get the gist of the question.
Honourable Speaker, there's an issue that the ministry in its statement regarding the subsidy says that private institutions will receive a predetermined rate as per NASFAF's rate in terms of funding to students. Last time I checked, NASFAF covers full tuition and registration fees for applicants. But now it has come to our attention that the ministry with NASFAF are only giving 10% of our tuition fees and registration fees. Registration fees, those deposits were already waived. Now, for instance, if I charge for a degree $64,000, NASFAF only pays me $16,000 per student, and that now creates an operational challenge to private institutions. The private institutions are now allowed to provide quality education at a 10% rate when they are not also allowed to charge not even registrations or deposits. Now, how are we expecting these private institutions to carry out the mandate that they are required to by the state in quality education? Now, that I'm asking now is.
Okay, Honourable Member, I think it would be better to just put that question in writing. Yeah, just put it in writing. Okay?
Okay, but yes, I'm not arguing, Speaker. I'm not arguing. I accept, but then if you are to do that, it's in writing, because tomorrow I was going to have another question. So,
yeah.
So that's my only concern. If you allow me to do 2 questions tomorrow.
No, Honourable Member. Just put one question at a time.
One
question at a time. As per the rules. As per the rules.
Okay, and please ask the colleagues.
Okay, please take your seat now.
The colleague, please.
Yeah. Now, Honorable Haikola has already, yeah, okay, so it's something else. Yeah, Honorable Kalola.
Finally, do I have a mic? Okay, I thank you, Honorable Speaker. Finally, mine, I've never asked the Prime Minister before, so I would like to address this question to you. Honorable Prime Minister, in 2009, there was a certain policy that was developed on remoteness. I know it came from bush allowance and remoteness and so on, but today is the 28th, and most of the schools are giving reports to their kids. And usually in our ministry, particularly in education, teachers volunteer to come and teach in holidays voluntarily, just to go extra miles for better results that we all desire in the country. Now, just back, I think a week ago, these teachers and other employees in the government were betrayed by this policy because they were assessing the remoteness to say that now you don't qualify anymore, so that allowance will be taken off. It's a disappointment because the assessment was not done in a good way. I can give you an example to say,
Honorable Member, what is the question?
Yes, I'm landing.
No. Please get to the question. First, actually, you are directing the question to the wrong MP. The MP that is responsible for the matter that you are querying is the Minister of Education, not the Prime Minister.
No, this thing is from the Minister of, it's the office of the Prime Minister.
No.
I think that time it was you.
No.
If you can remember.
No. That's about education. That's about...
It was placed in that, it was from your office.
Yeah, but the Honorable Member, can you pose your question?
Okay, thank you so much.
Yeah.
So now, most of the teachers are really frustrated and they want to come back and teach in holidays. Perhaps I'm just asking the PM, what kind of psychological support or motivation that you would like to give to the Namibian teachers to come and teach the kids? After this kind of disappointment, they can't even pay for the transport and so on. The bushes were not removed.
Okay, Honorable Member, now that question is out of order.
Thank you so much.
Honorable Member, the question is dismissed. The question is dismissed. Honorable Thomas.
Thank you, Honorable Speaker. Yesterday, I think today I'm lucky to give this.
If kids fail, you come as Speaker of Parliament, my kids are failing.
Yes, Honorable Speaker. I think today I'm lucky now because the Honorable Minister of Health is there. So I can pose this question which I supposed to pose yesterday. There are growing concern, Honorable Speaker, Honorable Minister. In this time around, throughout the country, there are teams from the Ministry of Health and Social Services going on the alert of vaccinations, on alert of polio. This campaign, I don't know. In the villages, in the town, these people entering other people's house, finding the children there, and start vaccinating. That is wrong. These people, they supposed to conduct or interact with the parents. And
Honorable
also they
Member,
don't have...
Can you pose the question?
Yes, they don't
Thomas?
have, they don't ask the health passport to indicate that. My question, Minister, are you aware of this? Or must I bring the evidence? I must bring evidence. Now, I'm having them. Thank you. Yes, I will bring the evidence. These things is not the Honorable Minister. You must ask, you must respond to the question. This is not jokes. This is a serious matter. No,
Yes,
this is a serious
Honorable
matter.
Member, just
If my child
if you
becomes
are
sick,
done,
what will happen?
Honorable Member, if you are done, are you done?
We must speak to those people to bring things, to do the correct things.
Honorable
in the
Member,
village.
are you done?
Thank you, I submit.
So, okay, Honorable Minister.
So, the evidence is here. See, I can bring it and bring it.
Honorable Members.
Oh.
Yeah, Honorable Minister.
Of complaints from communities that they are being coerced into any sort of vaccination. It is not the premise on which the Ministry of Health and Social Services operates. We conduct any sort of vaccination or immunization with permission from parents. The Ministry of Health and Social Services put out another post again today on our social media platforms that is circulating, and in bold on that says vaccination is voluntary. Now, if the honourable member is aware of any particular cases where children were vaccinated without permission of their parents or their caregivers, the honourable member, as opposed to perhaps holding up a cell phone, can maybe put that for me in writing, bring it forth, and then we will take it up. Thank you, honourable member.
Yes, thank you. Honourable members, I would just like to appeal to the chief whips. Yeah, in terms of the rules, the chief whips are the leaders of the team of MPs that are elected on the tickets of their political parties, and they have specific responsibilities to ensure their attendance, to ensure their compliance with the rules, yeah, including respecting the dressing code, respecting the time limit, respecting the ruling of the presiding officer. And I would like to call upon the chief whips to please carry out their duties as far as this part is concerned. Secondly, I would like to indicate that in terms of the rules, the questions are to be asked in writing. There should be a notice given of a question in writing, and then the question will be posed. It is not a vested right of a member to put a question orally. And I would like to indicate that when a member actually says, I was supposed to ask this question yesterday, and I'm asking it today. So it means even yesterday, you already were ready to ask the question. So you could have put that question in writing today. So that statement alone was enough for the presiding officer to disallow the question. I just would like to say that. And lastly, I can see that the honourable member is imploring upon the presiding officer to allow more MPs to ask questions. I feel truly constrained because we finished with the notices of questions, and then we went on to urgent oral questions. Now, I cannot finish one item, go on to the next one, and come back again. So that one is a challenge. But I want to implore the members once again to say the time limit is a time limit. It doesn't say it is a minimum time that you are given to ask a question. So if the time limit is 3 minutes, it doesn't mean that you have to take 3 minutes. If you take 1.5, 2 minutes, we can have more MPs to ask questions. So now we are constrained. The honourable member may ask her question tomorrow. We still have tomorrow. Hopefully, we are not going to spend the whole of tomorrow asking questions because tomorrow is Thursday. And we want to be able to answer the questions. Yeah, Honourable, I'm hearing you, but I hope you can also appreciate what I'm saying. The rules are saying you finish asking questions that are notified. After that, you go to urgent oral questions on the basis of a discretion. You cannot, after that, go back to notices of questions. It is not possible in terms of the order that we, what you call. It's not really that I don't appreciate whatever concern that you may have, but it's only tomorrow. You can pose your question tomorrow. Honourable members, then we go to notices of motions. It's notice of motion. Huh? Yeah, no, is it not some motions, ne? Yeah, what is it that the Honorable Cooper would like to do? Because it seems that the front desk knows and they are not quite sure what the nature of the matter is that the Honorable Member. Maybe, is it a point of privilege? Just say it so that I can hear what you want to say.
Honorable, no, it's a point of privilege, Honorable Speaker. Honorable Speaker, I wanted to submit to the House a request to consider and agree for us to meet tomorrow morning, 9 o'clock to 12:30. I so submit, Honorable Speaker.
Has there been consultations with the Chief Whip?
Yes, Honorable Speaker.
Yes. So, Honorable Member, that could have been maybe proposed as some kind of motion for consideration and endorsement by the House. So, is it agreed, Honorable Members, that we meet tomorrow from 9 o'clock to 12:30? Is Honorable Thomas objecting? So, okay, Honorable Thomas. Okay, Honorable Thomas. Yeah, Honorable Member, you are not allowed to address. Honorable Members. Honorable Members. Honorable Thomas, are you objecting? Honorable Members, can we listen to one another? Yeah, is Honorable Thomas objecting to the proposal too?
I'm objecting because I was not there.
Okay.
I was not consulted.
Okay, okay, fine, you have made your point. Now, is that objection supported? None? Okay, so it's agreed to. So we meet tomorrow at 9 to 12:30. Now, notices of motions. Honorable Somaye.
Thank you, Speaker. I move without notice in terms of Rule 124 of the Standing Rules and Order that leave and of absence due to official duties. In terms of Rule 76, be granted to Honorable Kaubay during the period of 5th to 15th June 2026.
Yes, you may table the motion,
Yeah.
Honorable. Honorable Lucato.
Honorable Speaker, Member of Parliament, today, Wednesday, 29 April 2026, I hereby give notice that on Thursday, 4 June 2026, I shall move that this August House discuss and agrees to table the motion on the admission of learners in government schools. I so move, Honorable Speaker.
Yes, please table the motion. Honorable. Honorable Haikola.
Thank you, Honorable Speaker. There exists within our labor system a disturbing and often invisible reality. Workplaces where intimidation, humiliation, and psychological abuse have become normalized. In some offices and institutions across Namibia, employees enjoy environments where respect is absent, dignity is undermined, and fear governs daily interactions. In such spaces, the workplaces ceases to be a site of productivity and become instead a place of emotional distress. Let there be no uncertainty. Workplace bullying is not a minor interpersonal issue. It is a system failure. It manifests through abuse of authority, persistent belittling, exclusion, intimidation, and deliberate undermining of employees. Many workers, particularly young professionals and junior staff, suffer in silence, constrained by fear of retaliation, job insecurity, or institutional indifference. However, the Namibian Constitution guarantees the right to human dignity, Article 8, and equality and freedom from discrimination, Article 10. Furthermore, the Labour Act 2007 establishes the foundation for fair labor practices, protection against unfair dismissal, and the duty of employers to maintain safe and equitable working environments. However, despite this legislation framework, workplace bullying remains in practice, indicating a gap between law enforcement and workplace reality. In contemporary labor discourse, two forms of organizational culture may be identified. One that prioritizes authority without accountability, and one that upholds dignity, fairness, and mutual respect. The question before the House is whether the workplace in Namibia will continue to operate under a culture of fear and silence, or whether they will align with the constitutional promise of dignity. Notice is hereby given, Speaker, that on Thursday, 30th April 2026, I shall move that this Assembly, 1, debate the prevalence, nature, and impact of workplace bullying in Namibia, particularly its emotional, psychological, and economic consequences. 2, examine the adequacy and enforcement of Labour Act 2007, the Constitution of Namibia, and related workplace and public service regulation in addressing workplace bullying and protecting employees. Number 3, propose the development of a comprehensive national anti-bullying framework, including clear definition, reporting mechanism, and protections for victims. Number 4, discuss the establishment of independent and accessible grievances system that ensure confidentiality, fairness, and protection against retaliation. Now, the last one, consider measures to promote workplace dignity, including awareness campaign, leadership accountability, and mandatory training on ethical and respectful conduct. I so move, Honorable Speaker.
Yes. Table the motion, please.
Okay.
Yes, I just would like to remind the Secretariat that notices of motions is 3 minutes, please. Honorable Kalola.
Many Namibian mothers, particularly in private and informal sectors, are forced to choose between their livelihoods and their mother's health due to lack of supportive workplace infrastructure. Both the Labour Act of 2007 and the Social Security Act of 1994 provide for maternity leave, but remain largely silent on the specific workplace protection required for breastfeeding employees returning to work. The World Health Organization and the UNICEF both recommend exclusive breastfeeding for the first 6 months of a child's life and continued breastfeeding for up to 2 years or beyond to ensure optimal child health, cognitive development, and maternal well-being. It has been noted with concern that the absence of private spaces often forces employees to express breast milk in hygienic environments like public restrooms, or leads to premature cessation of breastfeeding, which increases the national burden of infant malnutrition and illness. Research has constantly shown that breastfeeding-friendly workplaces lead to reduced staff absenteeism, higher...
Okay, point of order. Honorable Kengari. Honorable Karola, please.
Yes, I just want to, of course, I'm always in support of my dear brother and former president. But Honorable Speaker, when you were Prime Minister in the previous assembly, I remember that your office as Prime Minister led a process and that produced the report. So I'm wondering whether that report is still available or whether Table Office will find time to actually see whether there's a correlation between the notice that is being tabled now and that report that the then Prime Minister's office actually led. Thank you.
Yes, thank you. We will look at that because I do remember that I made an announcement about certain decisions that the Cabinet has taken in regard to matters of maternity leave. So I would hear the member out, and I would look at the notice of the motion and determine whether it overlaps with anything that has been decided already. Yes. Proceed, please, Honourable Member. Yes, you may take the floor.
Okay, thank you. And thank you, VP of UNAM. Okay, in light of these concerns, notice is hereby given that on Tuesday, June 2nd, 2026, I shall move that this Assembly mandate the ministry responsible for labor to draft regulations under the Labor Act requiring all employers to provide designated private location stations which are not bathrooms, equipped with a chair, electrical outlet, and a clean surface. Number 2, encourage the Ministry of Finance to consider tax incentives or rebates for small and medium enterprises that invest in on-site crèches or dedicated lactation rooms. You know, lactation rooms.
That's one.
Yeah, you know, other things. Number 3, urge the Ministry of Health and Social Services to launch a national compliance campaign to sensitize employers on the medical and economic benefits of supporting breastfeeding in the workplace. I so move, Honorable Speaker.
Yes, please table the notice. Yes, any ministerial statements? Reports from the Committee of the Whole Assembly and consequential proceedings. Orders of the day. The Secretary will read the first order of the day. Does the Honourable Minister of Health and Social Services, I'm thinking that we can go to committee stage and then we take a break. No, it's not your decision, Honourable Kandala. Yeah. Does the Honourable Minister of Health and Social Services move that the Assembly now goes into committee? Any objections? Who seconds the objection? Who seconds? Agreed to. I now call on the chairperson of the whole House Committee to take the chair. It has been ordered that I leave the chair.
House Committee is called to order. The Whole House Committee has to consider the Mental Health Bill. After division of yesterday, 28 April 2026, on how to proceed, whether to start from clause 1 or to proceed with clause 20, the majority of the honorable members voted in favor to proceed from clause 20. I now put clause 20. Any discussion? Any objection?
You understand the need and the agency why the benches on that side are pushing to fast track the process. You understand? Our big is knocking. You understand that? You understand our big is on your necks. But also, before the speaker left, we had agreed that we go into committee stage and go for our normal as per routine of the day. Go for our tea break, and then we come back, and then we sit properly in the house, in the committee. Then you start with the process like you wish us to start. That's the concern that we are having, and when I put it to the floor as such, it will be recorded as such, please. Yeah.
Honorable Kambala, I don't think that is what the whole House have agreed to. Can we move forward into it and see whether we can break in between? You can go for your break.
No,
and we continue.
Don't start with that nonsense. No, don't start with those things, man. We just said here now. No! The speaker just said there now. The speaker just said there. And we agreed. And we agreed. It's on record. It's on record. It's on record. No! Don't do those things. Don't do those things.
Honorable Kambala.
No!
Honorable Kambala.
No! The speaker was just there. Why don't you listen?
We are in the whole house.
The speaker was said that we agreed before we go to the whole.
Honorable Kambala.
We agreed.
Honorable Kambala.
No, don't do that.
The speaker chaired the session.
Yes.
This is the whole house.
No,
there is a difference.
Then we break. That's what we agreed.
Can we agree that each one?
Give the lady.
Can we agree that each one?
No, don't do
goes on his normal break? Should we now vote on that as well?
No, guys.
Should we vote on a tea break?
Yes.
No.
Yes, let us proceed. Democracy. No.
Oh.
Let's listen to what Honorable Somaib says. Just a bit. He's already on.
Those things. Don't do those things. No. We agreed already. Yes. No, don't do those things. No. What is so wrong?
Have a mic, please.
Oh, okay.
Yeah,
because you've not even told us why you're doing this. We can't just follow that. No,
Vice Chair,
no, that's wrong, man.
my submission is, let us listen to each other. I don't disturb anybody in this house, and I want to be listened to. My suggestion is, if you want to go to drink tea or to go to the toilet, just peacefully leave for us to proceed in the proceedings. Please. Yes. Because we are behind the schedule.
Is that the feeling of the House? Thank you.
Just continue. Don't give them the floor.
No, after that one I will not. Honorable Shitana.
Deputy Chair, it was agreed by the Speaker when she left that we are going to go on on the break after you take over. And are you telling us that today we are not going to have a break? Huh?
Now, honorable members, the majority agrees that we move forward with the mental health bill, and the honorable members who wants to go to the bathroom goes to the bathroom. Thank you. Yes, Honorable Shifeta.
No idea.
Yeah.
So, Honorable Deputy Chair, I think there are times when you make chores. There are also times when you are serious. Now, we have been wasting time all these days. Tomorrow is supposed to rise. And we have not done anything on most of the items on the agenda. Now, why don't we just, for today and tomorrow, really, instead of us debating and come up with tactical delays, just concentrate on what we can do for these 2 days. I'm not offending anybody, but I'm just saying there are times for jokes and times for seriousness, solemnity. And that's what I appeal to the House, that let us do what we're supposed to do. When the Speaker stepped out to then constitute a whole House committee, it is for that matter to continue on the agenda on a committee stage. It was not for us to adjourn. That was the agreed. Well, it was agreed by the House. That point was agreed. That's why the Speaker stepped out for the Deputy Chair of the whole House Committee to constitute the whole House Committee. That was the point.
Thank you, Honorable Shifeta. The objection was not based on the clause. It was based on a tea break. So there is no objection agreed to. I put clause. Okay, Honorable. Honorable Venane.
Honorable Deputy Chairperson, you asked objection. One was given. What does the House then do? Because just before that, the Honorable Speaker had attended to an objection by Honorable Thomas. And what she did was, she listened to what he objected to, and then she asked if there's anybody that supported the objection. There was none, so she carried. Now, you don't even want to give the opportunity for that objection to be supported or not. So what is the procedure when you ask, somebody objects, what is the procedure after that? Can you just dismiss it arbitrarily? That's all I'm asking.
Honorable Venani.
The Deputy Chair, I think Honorable Angula has a point. He has raised an objection. It is incumbent upon you as the Chair of the House, because this is a discretionary matter. It's a discretionary matter to go on break or not to go on break. It's a discretion of the House. So what you would do as Chair, you would say, there is a division on this matter. Do you have we are not going to vote the same way. You just say the ayes or the noes. So when the majority say aye, the ayes have it. Then you move. That's how you chair Congress. So just the procedure. Just say who is in support. Aye, we support. No, if the noes are bigger than the ayes, then we go to break. If we don't, as simple as that.
Thank you, Honorable Venani.
Yes.
Who is in support of the break? How many ayes? Who's in support of the break? Even, yeah. Hold on. Even he himself. Who, yeah. Now let's do it. Let's do it this way. The ones who are not in support of the break, lift up something that you have. Whoever wants to go for tea break, just go quietly and join us. Clause 21. We are done with clause 20. We agree to it. I now put clause 21. Any discussion? We are done. We are done with clause 20. You were confusing yourself. Yes, Honorable. Wait. Honorable Matun.
With all due respect, my line has been on to contribute on clause 20. We are on clause 20. Can I please have the opportunity? We ignore this chaos and that we can just make progress, please. Can I contribute on clause 20?
Proposal.
Okay. Thank you, Deputy Chairperson of the Whole House Committee. As previously stated, I want to contribute a possible amendment to clause 20 that we include clinical psychologists to determine the health status. I'm specifically referring to clause 20.1, where it states any determination concerning the mental health status of a patient must be made by a psychiatrist, and I think we should add, or a clinical psychologist, based on factors exclusively relevant to the mental health status of a patient. Then at subclause E, to add, next to psychiatrist, psychological diagnosis, and subclause I, if the psychiatrist or clinical psychologist is able to do so to state what is in her opinion. So I want to add clinical psychologist there. The reason being is I believe that clinical psychologists are very, very well versed with the DSM-5, and they are also more than qualified to be able to determine mental health status. We have less than 10 psychiatrists in this country, and we run the risk of creating a lot of bottlenecks if only psychiatrists can determine mental health status. So I want to implore this House that we add clinical psychologists in this section. Thank you very much.
Honourable members, there is a proposal on the table. What do we say? There is a proposal. Yes, Honourable Minister?
There's others. There's another one.
That's not how we do it.
She knows better.
No, the same clause as well. You know.
Minister of Health is on the floor.
Can you switch off that mic?
Thank you, Honourable Deputy Chair of the Whole House Committee. With regards to this particular proposed amendment, let me firstly clarify that the specialization of a psychiatrist is different from that of a psychologist. A psychiatrist is required, or what is required from them differs from that of a psychologist inherently. A psychiatrist is a medical practitioner, so they first study to be a medical doctor, and then you go and specialize to be a psychiatrist. So if I wanted to specialize, I could then opt to go and specialize in psychiatry as opposed to the path I chose, which is public health. So psychiatrists are first medical doctors that went to specialize compared to psychologists. Now, however, we do agree that in some instances, a psychiatrist may not be readily available, especially in non-urban centers. Therefore, the agreement would then be that clause 20 be amended to say, in cases involving forensic mental health patients, in other words, those that are referred for mental evaluation by the courts. Unfortunately for those patients, diagnosis must always be made by a psychiatrist. I think that is well understood by the entire House because of the legal process that must follow. Not just any practitioner can, because this will be used to make a court ruling. In cases involving general mental health patients, health practitioners, including the following, may do an assessment for the diagnosis of the mental health status of a patient, including a medical practitioner, a clinical psychologist, a nurse practitioner, or any other health practitioner that is fully trained in mental health. That is the proposed amendment. Thank you.
Are you happy? You are happy? Wait a bit. I will give you a chance. Honorable Maton?
I just want to thank the Minister for considering my amendment and including it into that. Thank you.
Any further contribution? Honorable members, let's listen to each other. Honorable Hangula? No.
Just tell your colleague.
Did you rise to address a member?
No, all I'm saying is the honorable member may know how these things work. But from clause 1 until clause 19, I don't remember me contributing and then the minister immediately contributing after that. So I wanted to ask, should I then prepare myself to be answered by the minister, or is the minister
You are not the minister responsible.
Or is the minister going to respond like, at the end of everything? That's all I wanted to ask. Clarity.
Yes, Honorable Angula. Honorable Maton had a proposal. And Honorable Minister, probably the ministry worked on that proposal already to be inserted in the amendments. That's why, because Honorable Maton spoke about it, she responded. Is that not the case? Yes, she's the mover. She knows what is in her bill.
So let's proceed. There's no objection.
I'm not Paula if I'm sitting here. I'm your deputy chair. Yes, Honorable Maton. Honorable Maton.
So I think what happened in this situation is an anomaly, because last week I already made my contribution for a possible amendment. I just repeated it. So this is an anomaly. It won't always be the same, but I think the minister has the right to be the first respondent to possible amendments.
Any further contribution on clause 20? Yes, Honorable Engari.
Thank you.
Honorable
very much,
members, there is
Deputy
nothing
Chairperson.
on the screens. Yes, Honorable Engari.
Thank you very much, Honorable Deputy Chairperson of the Whole House Committee. Am I right in my understanding then to think that the Minister will bring an amendment to this effect based on the discussion? Okay, thank you.
Honorable Esther Aikola. Honorable Kalola.
It's there.
Yes, Honorable Kalola.
These things that we are doing is very dangerous. Very dangerous. Very dangerous. It will not help us, all of us. It's clear. But it was just on a lighter note. Let me contribute. I would like to make amendment to clause 20.
Propose the amendment, Honorable. Propose amendment.
That's what he's saying. Let the man speak, talk, man. No, man. The man the yellow paper is reading or disturbing me. You should also start doing that now. At the end of the day, you know you think.
Honorable Kalola, can you continue?
We can be right sometimes. Otherwise, you're not going to be like, what is this?
Okay, amendments to the Mental Health Bill, Bill 8 of 2025. That, just a minute.
Which clause is that?
Just listen.
The fact that arms is here. The fact that arms is here.
The
fact that arms is here.
No, my he's reading. He's reading. How many times you cannot send that to read the document? No.
What is that, Honorable?
He's reading. What's the problem?
Clause, what is that, Honorable Kalola?
From questions to submissions, you are just preempting us. What is that? No. We also get frustrated. Listen to the man.
No, clause, what is that, Honorable Kalola?
Questions when he was reading his thing? No.
Clause 20.
Clause.
What is this?
No, deadline. Just leave them.
Honorable Paloti.
I ask that Honorable Kambala please withdraw that statement to the Honorable Deputy Chair.
We must just respect each other. That's all I'm pleading for. Honorable Kalola.
Respect our member also.
Honorable Kalola.
Honorable Maton was there reading, but he's busy reading, you are asking him.
I'm asking him which clause it is.
He said 20. I don't understand.
I want to make a contribution to clause 20. Start over.
You may continue.
No, you cannot come and
Thank
do
you.
like that.
Thank you. I would like to make contribution to section 20. That section 1 in the bill substitute subclause 1 of the clause 20 with the following clause. Any determination concerning the mental health status of a patient must be made by a medical practitioner based on factors exclusively. The basis of the amendments: number 1, the scope of practice and professional competence. Clause 20, sub 1, as currently drafted, restricts the determination of mental health status exclusively to psychiatrists. This fails to recognize that in practice and in law, medical practitioners, including those specializing in family medicine, emergency care, and psychiatry, routinely make such determinations. Moreover, the clause mistakenly excludes psychologists who are constitutionally and statutorily recognized health professionals from participating in mental health determinations, despite their specialized training in psychological assessment and diagnosis. This creates an artificial and legally unstable limitation on the practice of allied health professions. Number 2, inconsistency with clinical roles. Clause 20, 3D, further compounds the issue by requiring the psychiatrist to provide a medical report detailing the intelligence level of the patient. That is D. Psychometric testing and the administration of standardized intelligence assessment fall squarely within the professional domain of psychologists, not psychiatrists. Psychiatrists are trained in the biological, pharmacological, and medical management of mental disorder. To impose a duty of psychiatrists to perform functions for which they are not trained undermine clinical accuracy and integrity of assessment process. This provision, if retained, would lead to professional role confusion and potential legal liability. Number 3, I'm almost there. Practical impossibility in public health sector. The public health sector system currently employs fewer than 5 psychiatrists to serve the entire population in the country, requiring that all determinations of mental health status to be made exclusively by psychiatrists creates a strategical bottleneck that will inevitably result in delays, denial of care, and the effective paralysis of mental health services. This is not only imbrickable but also risk violating constitutional guarantees of access to health and right to dignity. The last one, policy and constitutional alignment. The proposed amendment aligns the bill with a constitutional framework that mandates the state to progressively realize access to health care. It also ensures that the bill reflects the actual organization of the health professions, respects the scope of practice of each profession, and avoids imposing unworkable obligations that will undermine the very objective the bill seeks to achieve. Honorable Minister, I would like to give you,
your time is up,
and I'm almost there, on the
your time is up,
SP
Honorable.
Professional Act 16 of 2024.
Your time is up, Honorable. Your time is up, Honorable
Okay,
Kalola.
just 1 minute, please. then
30
I'm done.
seconds at least.
Just 1
30
minute.
seconds.
Please, thank you.
The time is up.
Thank you
The
for
time
such.
is up, Honorable Kalola. May you be seated.
I'm just employing you. Just 1 minute.
The time is up, Honorable Kalola.
30 seconds.
Thank you for. Yes, Honorable Minister.
Thank you, Honorable Kalola. Sorry. Thank you, Honorable Kalola, for the questions. I'll answer them very briefly. The issue of the first point that you raised regarding the psychiatrist, I believe that was covered with Honorable Muton's amendment. Allow me just to read it again so that we can all be on the same page on that. The query by Honorable Kalola states that it is not only psychiatrists that should be able to make the assessments. And on that, we reached mutual agreement and we accepted the amendment. Let me just reiterate that part. Therefore, we agree that Clause 20 be amended as follows. In the case of forensic mental health patients, as I clarified, due to the nature of forensic patients, it must be a psychiatrist because of what is demanded by the law. In cases involving general mental health patients, health practitioners, including the following, may do an assessment for the diagnosis of mental health status of such patient, including, and then we gave the examples, being a medical practitioner, number 1. Number 2, we named clinical psychologist. Number 3, we said a nurse practitioner. Number 4, we said any other health practitioner that is trained sufficiently in mental health. I trust that this covers the Honourable Member's first question or point. With regards to the intelligence level, we did cover it previously, but allow me to just give an answer to this particular point. Intelligence, I suppose sometimes the query might come in because when you hear the intelligence level, we automatically are drawn to think of it as what we know day-to-day intelligence. So you are not intelligent, you are intelligent. But there is a scientific component to that. So intelligence level is a clinically valid and essential diagnostic factor. So we're not speaking about it in layman terms, we're speaking about it from a medical scientific perspective. Cognitive ability measured through standardized intelligence or neurocognitive assessments is fortunately or unfortunately, are fundamental in diagnosing many mental health and neurodevelopmental disorders, including intellectual disability, autism spectrum disorders, dementia, as well as neurocognitive disorders, schizophrenia and psychotic disorders, in which case cognitive impairment might be able to predict outcome, and then also in the cases of traumatic brain injury and neurological conditions. According to the International Psychiatric Guidelines, DSM-5, TR, and ICD-11, these do require cognitive or intellectual assessments to make several diagnoses. So this is according to the latest standardized guidelines. So if you ask medical practitioners, I have my team present today, before that, we were using DSM-4, DSM and all of that, and now we've shifted over. And according to the latest classifications now, to measure intelligence does fall within the psychiatric guidelines and is scientific and evidence-based. Intelligence levels predicts treatment response and treatment planning, and without it, unfortunately, we would be doing a big disservice to patients. Decades of research shows that a patient's cognitive capacity affects the ability to understand instructions, ability to adhere to treatment plans, capacity to consent to treatment, learning, ability in psychotherapy, response to cognitive behavioral therapies, as well as far as medication adherence. Therefore, allow me to just conclude because of time. The conclusion, therefore, on that point is that the intelligence level of a patient is not a social judgment as we might have become accustomed to it. It is a critical, clinical, and forensic variable. It is scientifically necessary for the diagnosis, capacity assessment, treatment planning, risk assessment, as well as determining criminal responsibility in some cases. Removing it would thus result in clinically unsafe care, legal injustice, misdiagnosis, inadequate treatment, as well as non-compliance with international psychiatric standards. With regards to the third comment that was then made by the honourable member, with regards to the state of the, I suppose I'd summarize it as the healthcare system, we take note of the fact that we have a limited number of psychiatrists in country at the moment, and that is why we rightfully so agreed with Honourable Muton's suggestion to say we move away from just psychiatrists to include other cadres as well. I hope I've answered the question.
Any objection? Honorable Kalula.
Okay, thank you. Honorable Minister, I would like to take you back again to perhaps to give you the meaning of medical practitioner. If you look at Health Profession Act 16 of 2024, here
Point of order, Honorable Engari. Honorable Hengari.
Yes, thank you very much, Honorable Deputy Chairperson of the All Health Committee. I think we must also understand that this is committee stage and not general debate. And I think we have all had the opportunity to engage these clauses in general debate, provide definitions and so forth. And therefore, I think if we are done deliberating on the proposed amendments, we should just move forward, honestly. Because how many more discussions are we going to allow on the same clause? Deputy Chairperson.
Yes, okay. Right Honorable Prime Minister. Right Honorable Prime Minister.
Point of
privilege.
But Honorable Hengari just took the words. I just wanted us to be able to clarify the understanding of the committee stage where we are in terms of the procedures, and understood it to be that we are here to do precisely what Honorable Hengari has said, and that whatever it is we are deliberating here, as was earlier on alluded to, it will have to be certified through the office that is empowered to do so, so that we do not belabor any issue that would unnecessarily delay the process that we must undertake and the process that must ensure that this long-awaited bill is passed and passed in the interest of those that it will serve, in the interest of those that are looking at us, expecting of us to make sure that we pass it as speedily as possible. So that was really the point I wanted to say, Honorable Chairperson of the whole House Committee.
Thank you very much, Right Honorable Prime Minister. Now, what I know of committee stages, it is specific, because we are done with the general debate. We have 3 stages in a bill: general debate, committee stage, and then the third reading. Honorable Kampala.
Yes, thank you very much. My apologies for my earlier grand outburst. But the deputy chairperson, the issue that we are trying to do here, and that's why I was saying that yesterday we were trying to raise this particular issue that we are to bring anybody, if it's 20 of us, bringing amendment to clause 20. We'll then
Can I assist you before you move forward?
No, just finish. Please allow me to finish. That will then all of us debate clause 20 and convince each other on why we are saying what we are saying for the betterment of this bill. Now, whether now I am bringing an issue that already agreed upon as a definition, it does not take away why I'm defending my clause. So if a member is defending a clause using the same bill or a supporting document thereof, let the member be allowed to do so without any hindrance. Because that is what we agreed at the chief whip's meeting. That is what should happen. And we agree, if you have found that Ina Ngari's clause is better than mine, then we agree, then we move on. But it should not take away from the debate. Just debate and lose the debate amicably. So allow the previous speaker to finish his argument, and if the minister has another argument, allow her. Then put it to the House, because there are two opposing submissions, and then you put it to the House, so if I one or two, we move. If it's two, if I agree with two, agree with two. If I agree with one, agree with one. That's how we agreed to move, Speaker. The Deputy Chairperson.
Honorable Kambala, as per the rules, as per the standing rules, orders and internal arrangements, we have a general debate where we debate. Then we come to the whole House committee where it is specific. Yes. Then we move over to the third reading where we are concluding. So we cannot do now as per the rules.
No, he is specific. He is section 20. He says that I want medical professionals to be included.
Honorable members, any objection?
How is that general? How is that general?
Just read what you briefed the House yesterday. What did you brief the House yesterday?
Now, the whole House is in session. The whole House committee is in session, Honorable Kandorodu. Honorable Kandorodu.
Yeah, Deputy Chairperson of the whole House Committee, I think this process is very simple, though. We are on supporting or changing the phrasing to sound legally according to your mind, the way you understand, and then the minister will come in, the way Honorable Mouton did in that process. That was a very good classical example that we need to follow after that. Now, during this session, we cannot have a statement. I think it's wrong there. Yes. We must just target that clause, that section, whether it sounds right or wrong, and make it right. I think, and then we finish with Jaco. Please.
Thank you very much. Any further discussion? No. Any objection?
Agreed to.
Agreed to. I now put clause 21. Any discussion? Any objection? Clause 21. We agreed already to clause 20. We have moved over to 21. Agreed to.
Yes.
I now move to clause 22.
Yes.
Any discussion? Any objection? 22. Honorable Brinkman.
Point of privilege. Honorable
We are not
Garola.
yet there. Let me inform you
Can I
how
ask-
the process works.
You have the mic.
There is
Can I-
somebody on the line.
Honorable Deputy Chair.
Honorable Chief Whip. Honorable Chief Whip. Honorable Brinkman is on the floor. The whole House Committee is in session. Honorable Brinkman.
I just want to know, Deputy Chair, if we have 5 contributions to Section 20, or we are 10 having contributions, how do we go on about it? Is it the decision of the minister? Is it the decision?
You want to listen to what she says?
With whose amendment are we going? Is it the minister that must decide? Or is it the House that must talk about it? That is where the confusion is coming in. Or who is taking, what is happening? What is the way forward then? If we are speaking 10 on Section 20.
I asked for any further discussions on clause 20.
It doesn't matter, any clause for that matter. Any clause. Any clause. What happens if we are more than 5 or 10? Then what do we do then? With whose amendment or contribution are we going? Is it clear, Chair, what I'm trying to ask?
Clear.
Thank you. I do.
22. Any discussion on clause 22? Yes, Honorable Engari.
Yes, thank you very much, Deputy Chairperson of the Whole House Committee, Honourable Minister. Under clause 22, subclause 3A, it reads as follows. I'll start with 3. If the voluntary patient at the time of filing the request referred to in subsection 1 is a child referred to in section 21, subsection 5, he or she must be immediately discharged if the head of the health facility is still satisfied that the child is of sufficient maturity. Honourable Minister, I just wanted to find out if you could expand on sufficient maturity and what would be the mechanisms used to determine sufficient maturity in this case. Thank you.
Yes, Honorable. Honorable Minister of Health.
Thank you, Honourable Member, for the question. So generally what we are referring to here, you will note that throughout the bill, there are numerous times when we refer to the fact that if they are at a level of maturity to make decisions, there we are referring to the Child Care Protection Act of 2015 that makes reference that a child from the age of 14 years old can make medical decisions for themselves. That is what we're referring to. Thank you very much.
Any further discussion, Honorable?
It is 14, yes.
What is 14? Honorable Shitana.
You see how you are confusing the House? Honorable Ina, she's reading from the white books. Honorable Muton and Honorable Kalola, they read from the yellow paper. You see how you are.
Do you have a proposal?
Hold on. Let me make my point. Let me make my point.
There is a point of order from Honorable Hengari, Honorable Shitana.
No, there was no one on the floor.
There is a point of order. You were on the floor. You are still on the
He's
floor.
on a point of order. Point of order and point of order.
On a point of order when I'm on point of order.
Point of order and point of order.
I must raise my case, then he come in. Yeah. So, just a clarity. Now, Honorable Muton, he does his submission. Then, is he now going to meet the minister behind the door to give the yellow paper? Or what is going to happen then? And those are the answers that's supposed to be in the SMS you read yesterday from the discussion of the chief whips.
Now,
So
how it
that is
works,
how
Honorable
you are
Shitana.
confusing the House.
How it works, Honorable Shitana, is that how it works is that a certified copy, no. No. What are you doing? It's not accepted. It's not accepted. That is not accepted. You are out of order. Honorable Ngari.
I just wanted to provide clarity on why I was reading from a white paper. The document that I'm holding in my hand is the substantive bill. The document that Honorable Mouton brought is the proposed amendment. So those are two different things. Just for clarity, I was reading from the proposed from the bill, and he was reading from. No, it's not true. No, it's not true. It's not true. Let me, in fact, Honorable Deputy Chairperson, through you, I think honestly and genuinely, what these honorable colleagues are doing is completely out of order. You know what it is? No, but you are out of order. You are out of order, you colleagues. You are out of order. No, you are out of order.
And Chairperson, you must rule them out.
No, I mean, the Honorable Kalola, he read his proposed amendment. The minister answered to the proposed amendment by stating exactly what he said when Honorable Mouton brought the amendment. No, colleagues, you guys are out of order. No, you're out of order. And you are not serious. No, you're not serious. No, you're not serious with your work. You are not serious.
We are at clause 22.
You are not serious.
Honorable Ina Ngari was looking for an explanation from the minister, which was sufficient. So any objection?
No.
Agreed to.
Very good.
Clause 23. Any discussion?
No.
Any objection?
No.
Agreed to. Clause 24. Any discussion? Any objection? Agreed to. Clause 25. Any discussion? Any objection? Agreed to. Clause 26. Any discussion? Any objection? Agreed to. Clause 27. Any objection? Any discussion? Any objection? Agreed to. Clause 28. Clause 28. Honorable Ishono.
I want to make it clear that we from IPC actually want to support the bill, the amendment. So I better be heard very, very well. Section 28 mirrors the South African licensing framework that in 2016, it did not prevent the Gauteng government from transferring 1,711 patients to 27 unlicensed NGOs. The South African Health Ombudsman confirmed at least 144 deaths. Where am I getting to? The law permits the transfer. The capacity does not exist to make it safe. Therefore, our intervention is here that the license regime must require the pre-licensing clinical staffing standards on site psychiatric oversight and audit general reporting, tie operationalization to the 70, whatever to have it, to the 79A implementation plan. That's my intervention. I hope you got it. If you don't get it,
Clause
forget about
28 section.
You will never get it.
Minister must assess 28 subsection. Community-based mental health care, is it the whole section 28? 28A. 28 1A. Let him present, Honorable Minister. Honorable
First, I must
Ishono.
explain something here. The reason I was just reading is because I realized I do not have a yellow paper. I was keeping it here, so may I go ahead? So that I do not break anything. Okay. I was saying, Section 28 mirrors the South African licensing framework that in 2026 did not prevent the Gauteng government from transferring 1,100.
No, Honorable Ishono, I'm looking for those Gauteng
My
things
intervention
here.
is here that
And I don't find Gauteng here.
I was first telling you before I tell you. Now hear me, please. Now I was going to our intervention as we are going to support this bill. This is our intervention. The license regime, the one that is giving those licenses to the institutions where people are, are we sitting together? Good. Because I'm looking at the minister, and the minister seems like she does not have a clue what I'm talking about. Okay. The license regime must require pre-licensing. Are you together? Clinical staffing standards, on-site psychiatric oversight, and audit general reporting. Is that difficult to understand? Okay. And then we said tie operationals to the 79A implementation plan. This one, my colleague Mo will help me with this one. I also have another submission on 29 when we get there.
We will come at 29. Honorable Minister. No, wait a bit, Honorable Lisasi. Is it the same issue?
You see, it's section 28, subsection 4. We are adding letter paragraph. Is it C? There's C there. We are adding paragraph D with that intervention.
Honorable Lisasi, I think you, Honorable Minister, are you with them? You understand? Honorable Minister of Health.
Thank you, Honorable Deputy Chair of the Whole House Committee. Thank you for the attempted correction. Can I just understand for D that the Honorable Member would like to insert? Can you just, without the entire motivation of Gauteng and all of that, can you just read what the phrase you want to insert at D so that we understand? So we want to include D and we wanted to read so that we can make sense of it, if possible.
Honorable Ishono.
My dear sister, are you okay? Our intervention is here is as follows. Please now listen attentively. It's English.
Yeah.
The license regime must require pre-licensing. Okay? Clinical staffing standards, on-site psychiatric oversight, and auditor general reporting. I can just stop there to make it easy. Do you get it? Wonderful.
Beautiful.
Honorable Luvendal.
So I think what the Honourable Member is referring to perhaps is requiring that we get into a bit more detail so that we don't miss perhaps to give licenses to people who have issues with clinical staffing and all of that, from what I'm understanding. Yes, good. So on the same page number 36, at the same subclause 4, it says, number 6, it says the Minister may reject an application for the issue of a license or for the renewal of an expired license under this section on the grounds that any one or more of the conditions referred to in subsection 3 or subsection 4 have not been complied with. So I am going to read us the number 3 and then I'll come back so that we have an understanding and say if we're still missing. Now, number 3 says where a consideration of an application submitted under subsection, the minister must be satisfied that the applicant is a health practitioner and undertakes to employ adequate qualified staff with the prescribed qualifications in the community-based mental health facility and to conduct in a manner conducive to physical, etc. So that addresses the issue of the facility being sufficiently staffed. Then number 2, the premises on which the applicant conducts or intends to conduct the community-based mental health care facility have been duly inspected in the manner contemplated under Section 10 of the Hospitals and Health Facilities Act. So in this particular act, you may not need to go into details of what the facility must have, but the Hospitals and Health Facilities Act that currently stands mandates what health facilities should have. And then I read that in conjunction with then number 6, which says the minister may reject a license if Section 3 or 4 have not been complied with, and then goes into detail to furnish the particulars. I hope that that answers the question. Thank you.
Honorable Ishono, does it address your... Thank you. Any further discussion? Any objection? Agreed to. I now put clause 29. Any discussion? Yes, Honorable Ishono.
Review boards. On the boards, we first want to understand how many boards can be constituted. We read of the boards there. It's not clear how many boards can be constituted in there. So we say our intervention, allow alternative qualified composition where psychiatrists are unavailable. Yeah? And mandate transparent reporting of unfilled boards. Those two. Thank you.
Honorable Minister, Lubendal.
Thank you, Honourable Member, again for the contribution. The number 29, where we are at, does state the number indirectly because it says that the Minister must, in respect of any mental health facility, pardon me, number 2, it says, despite subsection, the Minister may establish a review board for all mental health facilities providing mental health care or community-based mental health care facilities which are located in geographic regions. This means that each facility has the right to have a board. For example, this already exists. We actually have a review board for the Windhoek mental health facility. They see me after every quarter, I believe it is. Yes, so every quarter they come, they see me. They've raised numerous issues with regards to the facility. The reason why we've said every facility is because we don't want some to fall through the cracks. So it does state which facilities. With regards to the reporting, it is detailed in terms of the number of practitioners. It is also detailed in terms of the reporting that must be done to the Minister. Thank you.
Yes, Honorable Ishono.
We say in cases where the psychiatrists are not the alternative qualified composition, who can, in the absence of psychiatrists, who do we put alternatively? In 4A.
I believe 4A answers it. It says a review board consisting of 5 members must be composed of a psychiatrist or, if not available, a medical practitioner with at least a postgraduate diploma specializing in mental health care, a legal practitioner, an official from the ministry responsible for correctional services, a community representative, and the remaining member may be selected from any of the aforesaid professions or may be any other suitably qualified health practitioner. It does cover it. Thank you, Honourable Member.
Thank you, Honourable. Any further discussion? Any objection? Yes, yes, Honourable Nashinge.
Yeah, on the board, it's unfortunate we passed at the beginning the street dwelling citizens with mental issues are not really clearly defined. But here on the board, we will need, for example, on the board, what about the police, for example? don't we need the police? Because I'm only seeing correctional service there, or I miss the police. Don't we need to consider the police so that we can then have maybe a specialized training or process to empower officers to handle these colleagues? We see them on the streets. We need perhaps to wash them, get them new clothes, but who's going to because the police is in charge, it's outside. Correctional service is to handle issues within the correctional services. I just wanted to...
Thank you, Honorable Nashingi. Honorable Minister.
Chairperson, thank you, Honorable Member, for that. So I take us to 4A. The way I've read it, it says an official, so 5 members must be composed of a psychiatrist, if not available, medical practitioner with at least a postgraduate diploma specializing in mental care, a legal practitioner, then it says, comma, an official from the ministry responsible for correctional service. So not an official from correctional service, it merely highlights that it must be an official from whichever ministry is responsible for correctional service. So an official from the ministry under which correctional service falls, which you are right, the police then do fall in that category as well. Thank you.
Honorable April.
Thank you. Thank you, Deputy Chairperson of the Whole House Committee.
Honorable April.
Is Minister Clark?
Minister.
Are you done, Minister?
You want to, are you done? Okay. Honorable April. Law enforcement, probably. Honorable Ipumbu. That's the minister of that department.
I'm not mental, I know. I'm not responsible for the ministry of the bill that we are talking about, but I can respond regarding the people that form part composition of the committee that is being referred to, that it can be either from police or correctional service, and also to expand that the training, when it's extended by the Ministry of Health, it is inclusive of both police and correctional service. I so submit.
Thank you.
Honorable Nashinge.
With the law, we need to be specific. I'm just saying, we need to be specific. Correctional, we know what they do, and what is the correct term?
Police.
Yeah, law enforcement. So there is a need for, we have a young guy, for example, in town. So are we saying we are going to get correctional service to handle him with care, to get him treated or get assisted? So we need to be specific correctional, and NAMPOL, we need to have those guys in there, and the law must be clear. That's what I'm suggesting.
Honorable Minister. Honorable Minister.
All right, this is legal.
There is a difference between correctional service and the law enforcement. That's what Honorable Ims Nashinge is referring to.
It's legal. It's a bill.
Well understood. Sorry, I'm a bit confused. There's so much happening. If I can please be protected, I'm being told it's a bill. It's not mental health. Yes, so I don't know what's going on. Honorable member, we agree with you. With that said, and it is fine. We can make that insertion to just clarify it a little bit more. Thank you very much.
Honorable April. Honorable April.
That much. On subsection 5, is that is the correct reference, where we are talking about the possible reappointment of the board, of the members rather, in that particular board. I have noticed in our country, Doctor, that it becomes a fight and a difficulty for our people to not continue to serve once they have started to be serving on a board. Don't you think it would be advisable if we have a particular time frame in terms, instead of probably just reappointed, but maybe 2 more times or something like that, so that we do not have a scenario where board members will become pieces of furniture? That's one. The other one is, Doctor and Chairperson, Deputy Chairperson, the police and the what is it, the correctional service and psychiatrists, these people have got criterion that are formal and professional. How do you get a community member to be seen as suitable for serving on this type of a board? What is the criteria? What do you look into for that particular person to be seen as distinguished from the rest of other community members and therefore eligible to that particular board? So I suppose.
Honorable April, this is committee stage.
I'm asking questions on the committee stage.
Clarifications of questions.
Clarifications.
Honorable Minister.
Clarification.
Of the whole House Committee, with regards to number 5, where it says the term of office of a member of a review board is 3 years and a member is eligible for reappointment, we do see it fit. We feel that there are many Namibians that might qualify for these positions, and we don't necessarily want to recycle board members. We want to give young people and anybody with experience an adequate opportunity. And so if they qualify for reappointment, they will be reappointed, and there's not necessarily a need to specify. With regards to the community members that might qualify, I believe we did answer the particular question, so to speak, or concern, where we said a community representative, and the reason for that is because all the other cadres that we've given are specialized people. So we've said a medical practitioner with at least a postgraduate diploma specializing in mental health care, a legal practitioner, an official from the ministry, as now has been corrected, the correctional, as well as a police representative. However, because we are dealing with mental health and it is a deep issue of community, it is only right that the community are represented in the very boards that oversee the work that is done. Thank you very much.
Thank you, Honorable. Does it speak to your question, Honorable April? Thank you. Any objection? Honorable Nashinge.
Leaders or pastors, ne? Pastors or religious leaders plus traditional healers, ne? So what do we do? Don't we see value in them? Because we know issues in our communities, and these are the first people we run to assist us. What do we do? Because they add value to our ecosystem in our society, and they really assist us in many ways. What do we do? Are we cutting them out? Because I feel on that composition, perhaps a church leader or a traditional healer, we need to also consider them.
Thank you, Honorable Nashinge. Yes,
Thank you very much, Deputy Chairperson of the Whole House Committee. Thank you, Honourable Member. We do believe that all forms of community representatives are covered in that community representative. What we try to do is shy away from making it exclusive without an option to, like you're saying, involve other representatives. When we say a community member or community representatives, pastors and traditional leaders are also part. So we just made it a bit broader. Thank you, Honourable Member.
Honorable Mwashinange.
Thank you very much, Deputy Chairperson. I'm at page 37 there, establishment of and constitution of the review board. Now, Honourable Minister, just at 29 there, the Minister must, in respect of any mental health facility, a health facility providing mental health care or a community-based mental health care facility, establish a review board which must consist of at least 5 and not more than 7 members appointed by the Minister. Honourable Minister, I'm very concerned about this type of lawmaking because I'm looking at the feasibility of this, having this board at each and every mental health facility and also community-based facilities. So the feasibility is quite worrisome. And if we legislate it this way, it then say it's going to mean that you are going to be compelled to appoint these people. But I don't see it being feasible, honestly. Thank you.
Honourable Minister.
Thank you very much, Honourable Deputy Chairperson of the last committee. Thank you, Honourable Member, for the question. It is a valid question, or it is a valid comment. The reason for this is, firstly, we're looking at number one with the current facts on the ground and the health facilities we have. Now, quite all right, we have the two main facilities here and in the north. The reasoning really behind this is to say, and I think I answered it previously when I said, previously, and I think we can all agree, that mental health has not received the necessary attention that it requires. The issue of the review boards is a critical one, where we have said that in order to get accurate representation from each facility, bringing their accurate facts. For example, the review board brought facts to me about the mental health facility in Windhoek that I was not aware of from the time that I was appointed, and these were details in that particular facility. So the advantage they have is they provide detailed insights within the facilities, and what we have then done is, with these review boards, the more they increase, we have then said that these can report centrally and have then that particular caucus that reports back to the minister. The overall goal is just to have representation in each community where the patients are, and not to miss community level concerns, and then we tabulate that up to the top. Thank you.
Honorable Moshindange, are you satisfied?
Not really satisfied. No, Honourable Deputy Chair, I think, thank you very much, Honourable Minister, for that clarity. I mean, you see, my problem is, next year, for example, in the next financial year, what if we give you money to go and establish 10 more mental health facilities? As you are saying, we don't, it's not been given the attention it deserves. Now we say, we give you money to go and establish 10 more mental health facilities. What is the feasibility, honestly, of us legislating this way? That is my only issue, because let's not look at the 4 that we have now, because we are saying this is a decay in our community, in our country, and we want to address it head on. Now, as we are addressing it head on, it also means that we must, this assembly must also appropriate money towards that direction, because we are addressing it head on, because it hasn't been given the necessary attention. We give you money, you go and establish 10 more next year. What is the feasibility, honestly, of having a board at every facility? It's quite concerning. Thank you.
Honorable Luvendal. Honorable Minister of Health. Honorable Minister of Health. Yes.
Good. Thank you very much, Honorable Deputy Chairperson. The Honorable Member has a valid point, and the legal team has actually advised me that, you see, when you look back at 29, it says the Minister must, in respect of a mental health facility, provide mental health-based care, and then at number 2 it says, despite subsection 1, the Minister may establish a review board for mental health facilities and not necessarily must. And so I think it answers the question to say it is then within discretion to say, okay, there is no need, there's an oversaturation, so a valid point there. It is may.
Thank you very much. Any further discussion? Honorable Amtenya.
Yeah. No, 7A, right? A member of a review board must vacate office if that member become insolvent. I'm not so sure if that word insolvent is proper in these relations, or possibly we need to replace that word with something else. Because insolvent has to do with one unable to pay the debts, it has to do with monetary. It's just possibly a selection of the word. Thank you.
Honorable Luvendal.
Yeah, thank you. I think the opposition are helping me actually to answer the question very well. It is agreed that yes, it is a valid comment. Why? Because we've seen in numerous institutions issues of we've seen in numerous institutions issues of corruption and all of that. And so ultimately speaking, if you don't have sort of sound enough decision making and have been declared insolvent, the worry is that you will then not be able to exercise the required judgment to be able to oversee a facility and ensure that the best interest of the patients are met. Thank you very much.
Thank you. Any further discussion? Any objection? Agreed to. I now put clause 30. Any discussion? Honorable Ngari?
Section 30. Clause 30, subclause 2, please. Yes.
Subclause?
The review board may, by resolution duly adopted and recorded after proper inquiry, conditionally or unconditionally, discharge any patient other than an inmate or offender with a mental health condition and a forensic mental health patient detained in any health facility or community-based mental health care facility, whether or not such patient has recovered from the mental health condition. Honorable Minister, my concern here is that if we are making this law to ensure that whoever we send back into society to reintegrate is in the proper and right mental health condition or state in terms of their mental health, does this provision not go against those very intentions of the bill? And I was considering, and I'm wondering if we could remove, actually, why, in fact, it would be good to know why we would include that particular sentence to say whether or not such patient has recovered from the mental health condition, and just leave it as is, or perhaps even attach conditions under which that patient can be discharged from the health facility. I think this particular provision puts us at risk, especially to reinsert individuals who have not been given a proper record after they have received assistance from the mental health facilities. I so submit. Thank you, Chair.
Honorable Minister, Lubundao.
Thank you very much, Honorable Deputy Chairperson, Honorable Member. This particular clause does deal with the right of the review board to be able to, after taking all considerations into account, particularly here, what we want to deal with is the ability of, for example, patients to make requests to perhaps be discharged, and it is then reviewed by the review board, who then are able to make a decision to say, despite the fact that this patient is not deemed fit to return back, but because this request has been made by the patient or the relatives, the review board then take all this into account and are able to discharge. This is particularly important because we have, for example, cases where in the north, in Oshakati, at the mental health facility, where we've had actual cases whereby patients or their relatives perhaps would like them to be discharged despite medical advice. There are a lot of people that are in denial about the various diagnoses that may have been imposed perhaps on the medical practitioner. This is basically to safeguard their rights, is to say, once they have made a request, even if the board then sees that medically speaking they are not yet fit, but overall this is the request and they acknowledge the possible repercussions, they are then permitted to.
Thank you very much. Does that address? Thank you very much, Honorable Ngari. Any further discussion? Yes, Honorable Bronkman.
Thank you, Deputy Chair. There at 30, is it 1B? It says the review board must investigate any reasonable complaint or grievance. My question to the Honorable Minister is, what criteria will the board be using to know that a complaint is reasonable or not? Would it not have been better just to investigate any matter? How will we know that it is reasonable or not?
Honorable Minister.
Honorable Member, reasonable in this particular point, there are unfortunately certain complaints that are raised and have been raised within this particular space and sector that have been deemed to be unreasonable. It is not necessarily every complaint that must be taken up. There are certain matters that are perhaps a misunderstanding of perhaps the medical terms or whatever the case may be. So here what we are ultimately stating is it is not every complaint necessarily that must be thoroughly investigated. It is those that are deemed reasonable, within reasonable doubt of then the review board. This is in order to safeguard against the fact that I wouldn't call it petty complaints, but they are those which deem it necessary for the review board to go back and investigate, and those that for example, are not. If a patient says, for example, their food was not warm, that is a complaint that will be escalated, but does not necessarily demand that a full-on investigation. It just requires corrective action to make sure that this is considered next time. Thank you.
Any further discussion? Any objection? Agreed to. I now put clause 31. Any discussion? Any objection? Agreed to. I now put clause 32. Any discussion? Any objection? Agreed to. I now put clause 33. Any discussion? Any objection? Agreed to. I now put clause 34. Any discussion? Any discussion? Any objection? Agreed to. I now put clause 35. Any discussion? Any objection? Agreed to. I now put clause 36. Any discussion? Any objection? Agreed to. I now put clause 37. Any discussion? Any objection? Agreed to. I now put clause 38. Any discussion? Any objection? Agreed to. I now put clause 39. Any discussion? Any objection? Agreed to. I now put clause 40. Any discussion? Any objection? Agreed to. I now put clause 41. Any discussion? Any objection? Agreed to. I now put clause 42. Any objection? Any discussion? Any objection? Agreed to. I now put clause 43. Any discussion? Any objection? Agreed to. I now put clause 44. Any discussion? Any objection? Agreed to. I now put clause 45. Yes.
Just for interest's sake, can we identify the clauses where there is objection?
Any discussion? Any objection? Agreed to. I now put clause 46. Any discussion? Any objection? Agreed to. I now put clause 47. Any discussion? Any objection? Agreed to.
Yes.
I now put clause 48. Any discussion? Any objection? Agreed to. I now put clause 49. Any discussion? Any objection? Agreed to. I now put clause 50. Any discussion? Any objection? Agreed to. I now put clause 51. Any discussion? Any objection? Agreed to. I now put clause 52. Any discussion? Any objection? Agreed to. I now put clause 53. Any discussion? Honorable Haikola.
Thank you very much, Deputy Chairperson. I would like to make a contribution. Inmate or offender with mental health condition who lives secretly absconds from designated health facility 53A. A says, immediately notify and request any member of the Namibian police force to locate, apprehend, and return that inmate or offender that health facility offender to that health facility. Honorable Minister, I would like to propose that it would be good if we say, if this inmate is a woman or is a female, the police officer here must be a female. If this inmate is a male, she must be handled by another male to avoid sexual harassment, and also it's always be good. Honorable
members, let's listen to each other.
Please.
Honorable Haikola is on the floor.
Yes, please, take my point very serious, please.
Yeah, we must always take each other's points
if
serious.
it's a female, must be handled by another woman to avoid rape, sexual harassment, and sometimes just force, because this is a mental health patient. Okay, so I hope you took note of that one. So it shouldn't be any member of the Namibian police. And my second amendment must also be, it shouldn't just be any member, any Namibian police member, but it must be any member of the Namibian police force that is trained how to handle mental patients. Because if it's just any police officer, they will handle this patient very abruptly, not even putting into consideration, because there's always a difference between the person who is trained to handle these people and the person who is not trained. The second one is number 4, clause 4, subclause 4. It says, a member of the Namibian police force may only use the constraining measures, underlining that word, as may be necessary and appropriate in the circumstances when apprehending a person or performing any function in terms of this section. Honorable Minister, it would be great to specify here what type of constraining measures are we referring to in this case, because the police, sometimes they are trained, they are very rough, and sometimes also they may use excessive force, and a patient can be restrained in a way that can cause injury or even death. And some officers may may abuse their power and out of anger or bias or personal motive, because these constraining measures is not specified. They might overuse this power and they may injure the patient while they are in the hands of these Namibian police officers. I hope that makes sense.
Thank you, Honorable Minister.
Member, we take your points very seriously. Point number 53, firstly, the comment about the abuse. It was raised, a similar issue was raised in the second reading by Honorable Nekundi. Thank you. We did address that matter, and we did say the reason why perhaps that change must not be warranted. One of the reasons there is because, firstly, particularly when you work in the mental field, I see Minister of Gender Equality and Child Welfare will also be able to attest to this. Abuse is not just male to female. So even female to female, the abuse stance still stands. Now, how we deal with this is, you will note, my apologies, there's a lot of paperwork, but you will note that there's an entire section in part 3, number 12, that speaks to abuse, that speaks to the prohibition of exploitation of abuse, where we go into detail of what is then permitted and what is not permitted, which thus covers it. The second point regarding the trained officers, I want to highlight here, because the Honourable Member mentioned that there must be specific officers. Here we just want to emphasize the fact that this is merely for the purpose of apprehension. So it is not particularly any other actions, it is merely for the purposes of apprehension. However, the Honourable Member's point regarding training is valid, and it is also noted that we are working in conjunction with the Ministry of Home Affairs, Immigration Safety and Security to train all officers, because you cannot dictate which officer will be on demand. We cannot dictate when there will be an emergency where all the trained officers may be. And so we don't want to specify, because the goal is all our police officers must be trained with these basics. And that training, mind you, I have been informed by the team that that training is currently ongoing. Then finally, with regards to point number 4, a member of the police force, this is now with regards to constraining or perhaps restraining methods. Now, on this particular point, allow me to emphasize this. The regulations have now also been completed regarding this particular mental health bill. And in these regulations, we have then gone into detail to specify. Now, the reason for this is because of the fact that what perhaps is permitted today with regards to the restraining is not perhaps what is permitted tomorrow. So what we are saying here is ultimately we want to be able to protect the patient, and where the details of that, for example, in the regulations, we then specify certain areas of the body where pressure should not be placed. But because of the fact that this also goes with your international standards, this is subject to change depending on the current regulations. I so submit.
Thank you, Honorable Minister Lubundao. Bishop Festus Thomas.
This one. No, I don't have a question. I don't have objection. I just comment in that clause my sister Haikola said. Maybe the right way to be used there, a female and male and female, maybe there is another way used. We used to use that maybe in order to handle the gender sensitivities.
Yeah.
Maybe we can use that one as a mutatis mutandis. I think that one is the right word to be used in the law.
Yes,
thank you.
Bishop. Thank you very much, Honorable Bishop. Honorable Shiveta, gender sensitive.
I think just to give another input on the issue of inmates as offenders. These are offenders who are sent to facilities because during the conviction stage, in terms of Criminal Procedure Act, even if a person has done such a very horrible or committed such a very horrible commission of crime, that person, in terms of Criminal Procedure Act, if it's found, there are two questions. First, whether that person understands the proceedings of the court. Secondly, did that person appreciate the wrongfulness, his wrongfulness that time when he committed this crime? Now, this person, what happens that person is sent to these facilities. But the Criminal Procedure Act, in terms of handling a person of this nature, with these conditions, it also deals with
Clause
that.
53.
So there's a supplement. There's no need of worry about whether this person will be handled by female or males, but there are some already sections in terms of Criminal Procedure Act, and also how these people should be handled.
Thank you very much.
Honorable Lubundao. Oh,
it's agreed.
Honorable Lucado. Yes, Honorable Lucado.
Okay.
Are we at clause 53?
Yeah, thank you very much, Deputy Chairperson of all House Committee members. I'm having two questions to the relative sister, Honorable Minister. The first question is that how do you handle, or the ministry, how is going to handle the patients, those who are...
Honorable Lucato, clause 53, subclause what? Where are we?
Yeah, these two questions, they are also on that clause. Yes, that's why I want to pose question to the minister. It's regarding the patients those who have been held in correction services and also those in police custody. Since in Namibia, we have a shortage of police officers or stations, or those who should handle. How is the ministry going to handle pensions, those who are kept in the police cells? And also those who are going to be, those who are...
Honorable Lucato?
Yeah.
Honorable Lucato, that is general debate. If we talk of police cells and the ones in police cells, Honorable Minister, is it the two of them that was talking about those things? Honorable?
Yes.
This one specifically.
You see, you cannot prevent me while others they are being...
Honorable Lucato, continue.
It's not fair. Yes, not fair. Let the minister answer. Yes. Those are sick people being kept in the cells and also in the correction services. So the ministry, how can the ministry go to handle those people? Patients. Yes, that's my two questions.
Thank you, Honorable Lucato.
Yes.
It's not, we are not specific. That is not specific on 53. Minister, make sure that you answer Honorable Lucato at any other given time. Yes. Any discussion, any objection, agreed to. I now put clause 54. We are in a different, clarity on what? Clarity on what? No, Honorable. I heard what Honorable Lucato was asking. But it does not have anything to do with clause 53. I'm at clause 54. Any discussion, any objection, agreed to. I now put clause 55. Any objection, any discussion, any objection, agreed to. I now put clause 57. Any discussion? Yes, Honorable. Honorable Nashinge.
Thank you, Honorable Chairperson. The lawyers can assist. I just wanted to submit clause 57, 11, 57 sub. Article 4, how do you call them again? 4A. 4A there, perhaps, I'm looking at the time frame. A, perhaps if you can amend and read and say, an interim administrator appointed under this paragraph shall serve for not more than 30 days unless the master extends the period for good cause shown, not exceeding a further 30 days. Because now it's a bit vague. A.
4A.
Yeah, 50. I'm on 4A. Yeah. Yeah, thanks.
Honorable Lubandao.
Honorable Member, so it is clarified. This is quite an exhaustive actually section. So you will note that, yes, the Honourable Member mentioned the number 4. However, at 5, the master may, within 30 days after receipt of the application referred to in subsection, cause it, and then it goes on. Also, the details of administrator and where the confirmation of an official permanent one is detailed again at number 4, just below 15, just before 59. So it is clear.
Thank you.
Yeah.
Honourable Samwane.
Thank you very much, Honourable Deputy Speaker, Chairperson. On clause 57 sub 1, it states that any person over the age of 18, including a mental health practitioner, may apply to the master for the appointment of an administrator for a person with a mental health condition. This, I think, is a little bit concerning that any person can apply. So maybe we need some clarification whether this cannot be limited to a person with a relationship to the particular patient or a practitioner. Thank you very much.
Thank you very much, Honorable Damoni. Honorable Minister of Health.
Thank you, Honorable Deputy Chair. That is also answered in number 57. If we read further, it says any person over the age of 18, correct. Then at number 2, it says an application being referred to, and then it says in written oath. Number B says state the relationship of the applicant to the person who is the subject of the application. And if the applicant is not a spouse or next of kin of that person, the reason why the spouse of next of kin did not make the application. Thank you.
Thank you very much. Any discussion? Any objection? Agreed to. I put clause 58. Any discussion? Any objection? Objection, we are at objections. Honorable Kalola.
It's fair. The way you are, the speed that you are using is a bit problematic. Yes.
No. If you do not have a contribution to
you are not even. No. I'm talking to you, presiding. You are not even. Your head is just down. At least face up.
Any discussion on
Try to face
clause
up and look at the
58?
people because you are not looking at the computer. Look at the people and listen also. You are not doing anything on that.
Any discussion
You are
on
just
clause
enjoying that
58?
song.
Any objection? Agreed to. What help? No, Bishop.
The people are left in their heads also.
Yes.
What is meaning,
Yes.
General?
I thank you.
Yeah, that
I now put clause 59. Any discussion? Any objection? Agreed to. I now put clause 60. Any discussion? Any objection? Agreed to. I now put clause 61. Any discussion? Any objection? Agreed to. I now put clause 62. Any discussion? Any objection? Agreed to. I now put clause 63. Any discussion? Any objection? Agreed to. I now put clause 64. Any Minister?
Yes, Honourable Deputy Chairperson of the whole House, there was an amendment that was suggested for clause number 64. This was Honourable Amutse, Honourable Nekundi, pardon me, Honourable Nekundi. Offences, and we thus have agreed to the following amendment. Offences in connection with patients who abscond at number 64, it merely includes the word knowingly because the Honourable Minister mentioned that sometimes a patient with a mental health condition perhaps might ask for a lift and is then not able to, and at that point in time you're not able to discriminate, and so might give a lift unknowingly. So the clause merely includes the word knowingly, incites a patient to abscond or entices any patient from a place where the patient is admitted in terms of the Act. And so the difference there is the word knowingly has been inserted to clause 64. It is then certified.
Submit, Honourable Minister.
I don't have my shoes.
Submit, Honourable Minister.
Okay, without my shoes.
Now.
Put on your
It's 35. Minister Lubendao, bring.
Yes.
It's 35. Attorney General, honorable members, honorable members, honorable members, any discussion, any objection, agreed to. 65.
65.
I now put clause 66. Any discussion? 65.
65.
Oh, 65. Yes. Honorable Nashinge.
Thank you, Chairperson. On 65.3, on the issue of staff members in mental health facilities who have direct contact with patients, I just wanted to add, to insert perhaps that this individual should have police, how to call it, contact certificate. 65.3, that such individuals should have police conduct certificate. Those are now individuals that are in mental health facilities. And then maybe we can just add that and have a definition there to say they must, part of that, we should address the issue of assault, sexual offenses, abuse, neglect, fraud, theft, and any crime involving violence and dishonesty. So that it's just clear, so that we save ourselves from serious problems. That you are not just qualified, but you must also have a police certificate of conduct. That is 3. Yeah.
Honorable Minister.
Deputy Chairperson, I believe it is covered. Let me read it, perhaps if I'm mistaken. Number 65.3 says, staff members in a mental health facility who have direct contact with patients must, in the prescribed manner, at the prescribed times, provide to the head of that facility a police conduct certificate showing that they have no convictions in respect of the prescribed crimes. It is there.
Go to definitions.
It's within the definitions.
It's on the definition.
The Honorable Minister says, Honorable Nashinga, it's in the definition.
It will be also allowed
Is it?
in the regulations. It can also be
Is it?
It's in the definition.
Wait a bit. There's somebody else behind you.
That's true, though.
The regulation can also cover that in details.
Let's first deal with Honorable Nashinga's query, and then come to you thereafter. Yes, Honorable.
So thank you very much, Honorable Deputy Chairperson. Allow me to clarify that further to say we dealt with definitions already. So that the definition of crimes was then supposed to be listed within definitions, not here, unfortunately.
Regulations.
Yes, correct. Thank you very much.
Honorable Lillian Lutaesi.
Thank you, the Chairperson of the whole House. I'm rising on the point of procedure. I want to find out if there's an issue that the bill is silent on. That is very important. I'm wearing a green ribbon because I support the bill. But I find out that there's something that is omitted, and I've prepared a section that I want to add on the bill. Where do I put it in?
Which clause is that?
It's not in the bill.
It's a silent, when something is silent, it's not mentioned. For example, there is no integration of traditional healers in this bill. 70 to 90% of Namibians are from the Zambezi region. Before we take someone to the hospital, we consult the traditional healer. I wanted to put something in the bill that is omitted before we go in.
Thank you, Honorable Lutaesi. Honorable Minister.
Deputy Chairperson of the Whole House Committee, thank you, Honourable Member. This particular issue, it would be good if the Honourable Member can particularly note which clause she would like to insert this in, because at this committee stage we are dealing clause by clause. Also, I wish to emphasize and perhaps put the Honourable Member at ease, the Traditional Medicines Bill is already far advanced. It also sits under the Ministry of Health and Social Services, so we bring it to this very same House. Thank you very much.
Thank you. Any discussion? Any objection? agreed to. I now put clause 66. 66 is up behind you. Honorable Shitana. Honorable Shitana.
65 are paid. Honorable 66. Oh.
Honorable Shitana.
Yes, Chair. We are at clause 66, eh? Yes.
66.
Yes. Sharp at sub-rule 1. What is this?
Subsection.
Subsection 1. So the minister, I think it's page 75. Yeah. So a mental health practitioner or any person employed at a health facility might not provide, display, distribute, or otherwise expose any pornographic material to a patient in any health facility. This is only speaks about those that are employed there. Is a mental health practitioner or any person who is employed there? What about the visitor? The person who just came in there, and he or she happened to take a video recording of such person in secret, is not covered in this section. It's not covered anywhere. And we are really in a serious situation. I know you are good in those technology of AI things. You can be put there putting something in somebody's. Something that need to be put in secret. Because this is only prohibits those that are working there. But I can go there with that family member to escort him or her. Then I have to record something. Then I have to design something so that I can tarnish your name. What will happen then? I submit.
Yes, Honorable Minister Lubandao. Honorable Lubandao. Just a bit. Honorable Lubandao is on the floor.
Good. So a mental health practitioner or any person, I was saying that I believe the honourable member perhaps may have misunderstood the statement. So we generally cannot control to an extent of what the public is doing. This statement is not with regards to recording the patients. I'll read the statement. It says a mental health practitioner or any person employed at a health facility may not provide, display, distribute, or otherwise expose any pornographic material to a patient in any health facility. So this is dealing with the fact that as an employee of the Ministry of Health and Social Services at that mental health facility, you cannot expose pornographic material to that particular patient. I trust that that is clear. Thank you.
Honorable Shitana?
I do understand and agree with the minister, but I still have a question.
Sub 2.
Sub 2, it says, this practice is punishable to 20,000. Only for those that are working there. That is the point. Only for those that are working there. And as he's saying, she cannot control or be reliable to people that are coming in. Yes. And that is your facility that you brought the bill to this house to protect whatever is happening in that facility. You cannot say you cannot control those that are not part of that. If something happens in this house, all of us are included. That is the point I'm taking. And also to take you back is that, what if now the patient gets back his or her consciousness, then he starts doing something to those who are employed there. You must do something on that. I submit.
Honorable Minister Luvendam.
Honorable Deputy Chairperson, Honorable Member, we agree. We'll add it. Thank you.
Thank you. Wait a bit, honorable members. Honorable Zakaria Haikola.
Yeah, that's why, you see, when you were reading yesterday, the procedure was we air out our submissions and then the minister respond later. Because almost the same contribution that I wanted to make, almost similar, now I see that the minister is going to answer again something similar. But my contribution that I want to make is just that it's very important that when the mover must also pay attention to what we are saying, not just to answer abruptly. So my amendment or proposed amendment that I want to make is almost similar to what Shitana is saying, Honorable Shitana is saying, because in this case, what if it's a student nurse or a student doctor? Because it says a mental health practitioner or any person employed at a health facility may not provide, display, distribute, or otherwise expose any pornographic material to a patient in any health facility. What if this person is just a student nurse or a student psychiatrist who is doing her internship or attached to the health facility for a period of time? How about that person? But since you said you will include not just visitors, probably also to just look at even students. Thank you.
Thank you, Honorable Haikola. Honorable, okay, let us take all of them together and then you answer, Honorable Minister. Honorable Maton?
I know we have exceeded our time.
We are at article, we are at clause 66.
Yeah.
So we conclude 66 and then we continue tomorrow. No. Tomorrow is questions. So how do we do it now?
I just have a procedural question.
Finish. Okay, we will finish. Yes.
I have a procedural question.
Honorable Maton?
Thank you.
Honorable
I just
Maton?
want to know what the procedure is if we have agreed upon amendments and we already moved past that clause. How do we now does the minister now table the amendments as she did with the one of Honorable Nkundi, so that the bill can be amended when we pass a specific clause?
You mean in terms of yours?
Yes.
Did you not listen to Honorable Minister? She have included yours.
No, but she didn't table the amendment.
You know that was done during the general debate.
No.
And then taken to the Attorney General for certification.
Yes.
It's only amendments which is certified by the Attorney General which will be moved by the Minister.
So now, my point exactly, since we have discussed and debated on amendments, and the amendments have been agreed upon, but we passed the clause, how are those amendments tabled? What's the procedure if we pass the clause for those amendments to be tabled?
You mean yours specifically that you have
Yes,
taken?
and also some of
it is included.
and some of the others that the minister agreed upon that will make slight amendments. Thank you.
In the third reading. Okay, Honorable Minister.
Thank you very much, Honorable Deputy Chairperson. The amendments, all the amendments that have been agreed upon, that is why we have a team here present, as well as the legal drafter actually following us online. So all of these amendments that we have accepted and agreed to on the House will be made as the procedure that we have agreed to. So this will now be taken to the legal drafters, who will then assess it, include it within the bill. This will then be sent to the Attorney General for certification, and then will be brought to the House. Thank you very much.
Angula, Honorable Angula.
It's really very, very important that we are clear on what we are doing, Honorable Deputy Chairperson. This was the reason why we even set the bill aside for a while, is so that we can find the right way to do these things. in the very beginning, the Deputy Speaker, Honorable Katamelo, is the one that
Honorable
brought this
member.
to the attention of the House. Now, when we set it
Honorable
aside,
member.
Honorable, please, can I just, we said, let us go convene the chief whips and discuss
No,
this.
Honorable member.
Wait, please.
You
We
cannot,
did
you
that.
cannot
No,
hold
no.
us hostage.
No,
You cannot hold us hostage.
Can I?
No, we have been held hostage ever
I'm
since
trying
we
to
have
assist
started
here.
with this mental health bill by you.
Honorable, please, you've given me the floor. Just allow me to speak, and then you can.
No, but then you are not on the process.
What we agreed was the same way that Honorable Lubindao had this yellow paper. We don't know where she got it from, of Honorable Nekundi. We agreed that when we do our amendments, we give them, like the honorable members did, we give them on the yellow paper, and then that yellow paper is submitted to the ministry, and then they can do whatever thing they do, take it to the drafters, the Attorney General, and then these honorable members will come and sign off to say, we are the one, I am the one that submitted that amendment.
Is that a new way of lawmaking?
The question is, how does Honorable Muton and Honorable Kalola get to the stage where they sign off on those yellow papers? That's the question I'm asking.
Honorable Lubandao.
Answered, and what we did say at that point is when we had the conversations was that the reason why the yellow papers perhaps that are brought cannot necessarily be accepted like that is because when we discuss, for example, Honorable Muton's first proposed amendment had a request. We could not fulfill that entire request. It was amended on the floor. And so as amended, so what you've put on a yellow paper is not necessarily immediately agreed on. So this was the conversation then we had. But for the honorable member who smiles a lot, for the particular honorable member, what we definitely can do is that as soon as we have it documented in terms of the amendments that have been agreed on all in detail, if it so suffices to the lovely honourable member, we can then come to the honourable members for them to sign off before it goes to the legal drafters.
Are you at clause 66? Are you at clause 66? Any discussion on clause 66? Any objection? Agreed to. I now put clause 67. Honorable Ikando.
Tomorrow is not a problem. As a speaker, can you eat this?
Yeah. That's it, Ali. I will now call Honorable Speaker and report progress. That's what you wanted. That's what they wanted. But we have moved.
Is it?
Speaker, I report progress and ask for you to sit down.
Honorable members, based on the rule on automatic adjournment, the House will now adjourn until tomorrow at 9 hours in the morning. 9.